Bore da a chroeso I gyfarfod y bwrdd. Good morning and welcome to today's Digital Healthcare in Wales board meeting, the last public board meeting of 2022. As usual, normal practice, we're holding the meeting virtually, and people are being able to link live to our meeting today. And there's also the opportunity to catch up after we've finished by using the link, clicking on the link on our website, and you'll be able to see a recording of today's meeting. We are using simultaneous translation, as is our custom and practice. If you need to hear a translation of the Welsh, then if you hover on your screen, you'll see the globe and the icons towards the bottom. It's the second in from the right. If you click on that and you select Hear Translation and just leave it on that selection, then as and when people are using Welsh, you will hear a translation. Usual advice that sometimes we're not always going to be looking at the camera. That's we need to be looking at our papers, for which we apologize. And we will be taking a comfort break during the morning, and then we will be breaking for lunch at around about I think it's around about 12:15. I've slightly rejigged the order of the agenda to the published papers, because David Selway, who chairs the independent member digital network, needs to leave us at lunchtime. So we're going to take the report of the last meeting, his report of the last meeting, just before we break for lunch. Hopefully that will be suit you and be convenient for yourself, David. I would like to welcome a new member to the board, a new board member. That's Sam Hall, who's our Director of Primary Community and Mental Health Digital Services. Welcome, Sam. Sam joins us from being the Chief Digital Officer at the Welsh Local Government Association. We very much look forward to your contribution around the board table, Sam, and indeed your contribution to what is a new role for us. So welcome, Sam. And then we will be welcoming some people joining us for various items on the agenda through today. Jessica Scorer is joining us in a moment. She's the e-library and knowledge services manager, and also Michelle Sell will be joining us for relevant items of the agenda later on in this morning and this afternoon. So I'll now crack on with you to today's agenda. Apologies for absence. There've been no apologies for absence that I'm aware of. Everyone seems to be here. Declarations of interest. Marion Wynne-Jones has advised us. I think it's more a declaration of involvement, Marion, but it's good of you to notify us that there's a declaration of interest around agenda item 2.7 policy report, where we'll be approving the adoption of our Welsh language scheme. And Marion, as people will know, was chair of the Welsh Government's More Than Words Task and Finish group, which had a significant role to play in the adoption of Welsh language schemes and the use of Welsh in NHS Wales. So thank you. We note that declaration, Marion. I haven't had any others. Has anyone got anything that's occurred to them having looked through the agenda? No. Okay, thank you very much. If I move on then to the consent agenda, and as is usual, hopefully people have drawn something to the attention of the relevant officer in advance of the meeting, and that has been dealt with. If there are any issues and I haven't been advised of any, then we will endeavour to find space on the agenda for them. So I'm sure you'll pipe up if there are. Okay, so if I then move on to those things that we need to approve and note as part of the consent agenda. We're approving the minutes from the board meeting held on the 29th of September. They're subject to some minor typographical amendments. And then also, people happy for that to be approved? That yes. We're approving the minutes held from a private board meeting held on the 29th of September again. People happy with that? Yes, thank you. We're approving the minutes from the board meeting held on the 26th of October, and this is subject to a minor amendment to ensure that we highlight that the financial transfer and forecast position of the link and risk programs would need to be validated. So that minor amendment, people happy to approve those minutes? Yes, thank you very much. And then we are approving we've had a lot of meetings both since the last meeting. We are approving the minutes from the private board meeting held on the 26th of October. Oh, sorry, I've covered that one off. And then I'm asked members of the board to note the action log. 2 actions are underway. 2 are complete, and perhaps draw your particular attention to, and it's included in the board pack, the pledge that every member of the board has now signed, signing up to the values and behaviours of the organisation. I'm really pleased to see that that we've all done that, and one more board member to join us, and I know I'm sure he'll be equally pleased to sign that pledge. So obviously happy to note that. Then noting the forward work plan at item 2.6, and approving the handling concerns and complaints policy, and the one I referred to earlier in the context of Marion, the Welsh language scheme. Are people happy to approve those 2 policy documents? Perhaps I've missed out one thing in terms of the action log, an action that we anticipate being closed by the next meeting, where Evan Evans and Sam Hull are going to be discussing in detail the organisation's role in care. And as I say, we anticipate that action being closed by January. Okay, if I move on then to the main agenda, and as is usual, the first item on the agenda is a shared listening and learning presentation. And today we're hearing about the e-library service. So I'm going to hand over to Rydian, if you'd like to introduce the shared listening and learning presentation, Rydian.
Thank you very much, Simon. Good morning, everyone. I'm proud to introduce this element of the work that we do, Simon, because this truly does cover health and social care. The ability to access peer review literature, evidence, clinical guidance, things that reassure clinicians that they're doing the right thing, or indeed signpost them to do the right thing, is a very important part of delivering patient care. The service, which I would encourage the public, they could look online at ehl.nhs.wales, and can see some of the excellent work that is delivered by this team. So I'm not going to steal their thunder, but other than to introduce another rising star of our organisation, Jessica is seconded in for Rachel Sully, who's probably watching at home, being a recent mother yet again. So I'll hand over to Jessica. Thank you, Jessica.
Thank you, Rydian. So Bore da, good morning, everyone. Thank you for that introduction. If you could go to the next slide, please. Fab. So I'm going to start this presentation by introducing you to the eLibrary team, if you don't already know them, and I'll introduce you to our purpose and vision as well. I'm then going to run you through our robust governance structure and procurement process. This ensures value for money and that our users' needs are met. I'll give you an insight into our vast collection of electronic resources, which, as Rydian says, we'd really encourage you all to use, and I'll tell you how we engage with our users and stakeholders. I'll then let you know about 2 of our exciting collaborative projects. I just had to pick 2. We've got quite a few going on, but with limited time, and I'll let you know where we are with them at the moment. And I'll finally give you an insight into what the eLibrary means to our users and stakeholders. So quite a lot to cover in 10 minutes. Next slide, please. So the eLibrary team sits under the Clinical Directorate and is within the Information Intelligence and Research Department. We are a small team made up of myself as interim service lead. My role involves delivering the eLibrary's 3-year plan and our milestones within DHCW's integrated midterm plan, and covers the majority of our procurements. There's also John Dunkley-Williams, who is the librarian specialist and takes responsibility for the day-to-day running of the eLibrary and technical aspects of our e-resources. And there's Bex Merrick, the engagement and learning specialist, who leads on all things engagement and training. So the eLibrary also receives some admin support from a clinical directorate facilitator, and we are in the process of filling this post at the moment. Next slide, please. So our purpose is to provide a user-led digital collection of evidence-based information for all of NHS Wales. And our vision is to provide value for money, promote the eLibrary service to our users, empower NHS Wales to use our e-resources, and also to innovate, develop and grow our collections to ensure we continue to provide reliable resources for evidence-based care. Next slide, please. So I'm now going to tell you about our governance and procurement process. So the eLibrary is governed by the eLibrary Service Board, who meet quarterly and have representatives from our stakeholder groups. And these groups are NHS Wales Library and Knowledge Service, or NHSWLKS, Public Health Wales, Health Education and Improvement Wales, or HEIW, and Welsh Government. There is also the eLibrary Champions Group, which sits under Service Board to support them with their decision making, and this group also meets quarterly. So the group includes health and care professionals and subject matter experts to ensure that the eLibrary and the resources it procures represent the vast array of professions within NHS Wales. And a representative from this Champions Group will attend each Service Board meeting. Where required with our procurements, task and finish groups are established to support these projects by exploring new resources further. And like the Champions, they help support Service Board with decision making. So as well as these governance groups, the eLibrary team work closely with digital library services from other countries in the NHS, so England, Ireland, Northern Ireland and Scotland. Together, we are the 5 Nations Digital Libraries and e-Resources Group, and we meet quarterly to support each other by sharing experiences with procurement, contract management and management of digital libraries. And I've actually got a meeting with them after this today. So as well as these groups, BEX, our Engagement and Learning Specialist, is part of the NHS Wales Library and Knowledge Service Training Group. So this group works together to deliver training days and workshops to NHS Wales employees. And the training group have actually recently been awarded the 2022 CILIP Cymru Wales Team of the Year Award for their work producing a fantastic programme of literature and evidence searching webinars. So I'm really proud that their work has been recognised by CILIP. And for those that don't know, CILIP is the UK's Library and Information Association. So that's our governance, and then our procurement process. So the eLibrary regularly review all procured resources as well as new recommended resources to ensure quality and value for money. For re-procurements, we analyse usage data and user feedback each year as part of this review process. And for new recommendations, these are received directly from users via the Contact Us page on the website, also via emails and engagement activities, and via stakeholder group representatives. And the eLibrary commits to reviewing all recommended e-resources in line with our collection development policy, and we follow up with users as well to confirm the outcome of these reviews. The eLibrary then submits our procurement recommendation to the eLibrary Champions Group for approval, and then to Service Board for approval. And we then work with commercial services and Service Board together to write up the tender specification to ensure our users' needs will be met by the resource. Once the tender has been issued for the resource, a procurement panel is established, and this is made up of Service Board representatives as well as the eLibrary, to evaluate the supplier responses before awarding the tender and completing the procurement. And we get support from commercial services through this process as well. 6-month review meetings with suppliers are written into our contracts so that we can ensure our requirements are being met while the contract is running and not waiting until the end. We bring evidence to these meetings, including records of supplier response times to our users' queries. And then finally, in the lead up to the end of the contract, the procurement reviews start again. So all of this ensures collaboration, transparency and accountability for the eLibrary's decision making. Next slide, please. So the eLibrary is home to NHS Wales's largest source of evidence and digital information, including e-journals, e-books, databases, evidence summaries, professional guidelines, medicines information, and e-learning, including subject guides, training videos, and podcasts. So there's a lot of content on there. And these are housed on our website. So you can scan the QR code on this slide, or as Rydian said at the start, you can go to elh.nhs.wales. And then once you're at the site, there's an option for Cymraeg in the top right corner. On the website, there is a search bar on the homepage, which is the top right screenshot on the slide. And this takes users to Library Search, our eLibrary catalogue, which is the bottom right screenshot. And this is where users can search through the whole of our collection. But we are always keen to embed our e-resources into clinical systems to benefit clinicians with evidence-based information at the point of need when treating patients. So for example, last year, the eLibrary worked closely with the Nursing Care Record Project to link nursing resources such as the Royal Marsden Manual into the system to make accessing evidence where care is delivered even easier. Next slide, please. So the eLibrary is a user-led service, and we continuously engage with wide and diverse audiences through social media, live and recorded webinars, podcasts, and virtual and in-person events. We also support users through help guides, videos, and offer one-to-one online support through Microsoft Teams chats and video calls after receiving requests through our service desk tool. We also engage with our suppliers of e-resources, ensuring that views and priorities of NHS Wales audiences are received and acted on in order to meet the needs of our users. Next slide, please. So that was a very quick whistle-stop tour of the eLibrary, and I'm now going to briefly highlight 2 projects that the eLibrary are very proud of. So the first is the Single Sign-On project, which has involved collaboration between the eLibrary, DHCW, our stakeholders, and Cardiff University. So Single Sign-On allows users to easily access digital content using their NHS Wales email address and system password, without the need to also self-register for an Open Athens account, as this will automatically be created for them when they sign in. So Open Athens is our authentication system that we use. So the pandemic accelerated this project, and it enabled more users to seamlessly access evidence-based information to support their practice during this unprecedented time. Although self-registering with Open Athens is no longer required, currently users still need to sign up for a library account in order to access e-resources. But the next stage of this project is to achieve true single sign-on, where users will be able to access e-resources with only their NHS credentials, and this will ensure truly seamless access. And the second project I'd like to highlight is the Social Care Worker Provision Project, which is in collaboration with our stakeholders and Social Care Wales. So from January 23, so not long to go now, we will extend access to our e-resources to social care workers across Wales, and this is including those who do not work directly alongside NHS Wales services. So they will be able to access via Open Athens. And in anticipation for this rollout, the eLibrary have procured social care e-journals and databases, and further social care ebooks are due for procurement in the new year. So this project is a really fab project, and it will ensure evidence-based information is available to both health and social care, improving the patient experience. Next slide, please. Ooh. Next slide, please. I don't know if it's changed for everyone else. I can still see the, oh, fab. Sorry, that might have been my delay. So before I finish, I just wanted to share with you an insight into what the eLibrary means to our stakeholders. We're always seeking feedback via Service Point and following training sessions and support sessions in order to continually improve our service. And these are just some examples of the feedback my eLibrary colleagues have received over the past year. So these are before I started last month, so I can't take credit for any of them. And then if you could pop to the next slide. There's just a few more. I'll leave them up on the screen for now, but that's all from me. Thank you very much for your attention this morning. And are there any questions?
I'm sure there will be, Jessica. That was great. Ridgeon, did you want to come in or no?
I'll do my best.
I'm very grateful for Jessica and the team and Rachel for that. I hope you spotted the engagement program photo chair. We were able to give Judith Paget an EHL bag for life. And I'd just like to say it's a bag for learning for life. So I hope you spotted the way we managed to put that into the program. We'll take some questions.
Excellent. And I'll come back in a minute. I've got Alistair and Marion and then Rowan.
Thanks, Chair, and thanks, Jess, for a really interesting presentation. Really found that tremendous, and I was so struck by the amount of resource that you have run through that's available, and just thinking through the capabilities of this, the extension of this to, if I heard you correctly, Jess, to all social care workers in Wales, I'm not aware of any other mechanism through which we can reach all social care workers in Wales that has a Wales public sector focus, let alone NHS and social care. And I think it's something that we really should explore, just how that can be developed. So, for example, they are in many ways the field soldiers who are supporting people who require care to stay and live independently in their own home, and hopefully they will be happier. They generally feedback they're always happier in their own home. And of course, the prevention of those people entering our hospitals in avoidable ways. So the way in which we can stimulate and develop through social care workers prevention and the potential for stimulating knowledge about healthy lifestyles would be something I think I'd be very, very interested to see how that can be explored. They're people who will benefit from access to information about healthy lifestyle, and they may well be able to move this on to the people that they care for. But it seems to me that it's a really, really interesting new opportunity with a resource that could be expanded in very interesting ways. So I really appreciate the outline. Thank you.
No, thank you. Sorry.
No, go on, Jess. Go on, Jessica. Go on.
No. That was a really good point, a really excellent point. And we've established. I didn't put it in the presentation. I should have put that in. But when I mentioned task and finish groups, we have one of those for the social care provision project. So we'll be working with them continuously. Just because it's been rolled out, that doesn't stop there. We'll have training programs established, social media campaigns, and to try and get the word out there to everybody, and make sure that all social care workers are aware that this resource is here and that they can have input and we can expand as time goes on. But thank you.
Marion. We're not hearing you, Marion, but it doesn't look like you're on mute, which is strange. Got it? Yeah, we've got you.
Thank you very much. And thank you, Jessica. It's really interesting to hear about this fantastic resource that's available and to get to understand more about the wide range of services that you offer. And it's really encouraging to hear about the extension into social workers, as you mentioned. I'm interested in hearing to what extent we reach all employees and workers in the health service. What percentage or proportion of employees are users of this fantastic resource? And if there is a need to increase awareness and extend and expand the number of users, what could we do, I wonder, to actually reach a wider audience? Thank you.
Thank you. No, I think that's a really good point. I can't give you off the top of my head any percentages or anything like that, but I will take that away because that is a really good point. With our usage statistics, we use a system called Counter, and this will record numbers of usage, and we can work that down to health boards, so we can work out how many users in each health board are using the resources. But in terms of breaking down further than that, I'm not aware of a way that we can do that with the system. But in terms of speaking with our stakeholders and our task and finish groups, service board representatives, all of these useful resources and contacts we can use to help reach out to as many people as we can and to also receive their feedback as well. But I do know that we do need to do more work to make sure that we're expanding out to more and more of our users, because we have feedback surveys, but of course these naturally aren't going to be filled out by everybody. So that's definitely something that we need to work on. But we're always taking on board feedback from our stakeholders for any groups that we're not reaching. But yes, great. Something we will continuously work on.
Rowan and then Helen.
Simon. Hi, Jessica, thank you for that. And I particularly was interested in the point in your presentation where you referenced enabling people to be prompted with context-sensitive information in the course of their work. So not just relying on people to go and find information, but actually pushing information at them where relevant. And I know that in the UK at the moment, we're changing some of the copyright laws as we come out of the EU to allow more processing of what essentially is unstructured data. So how are we planning to build on top of this resource to do more pushing of information out into decision making across the clinical areas? Be really interesting to hear the thoughts on that.
Thank you. Well, in terms of your copyright point, that kind of resonated with me. So we're doing our re-procurement of the CLA, the copyright license procurement at the moment, and part of that is CLA Plus, which is a collaboration kind of part of CLA, and that will allow us to kind of share a lot more information when we work outside of our organisation as well. So that's really exciting. We do have it as part of it now, but we've kind of honed in on the tender specifications for the next procurement. So that's great. There's also a ongoing project, but it hasn't launched yet, called Lean Library. And this is a browser extension, which the plan is to have this rolled out across all of NHS Wales. And this is, I'm not sure if it will answer your point, so please let me know if it doesn't, but this allows pop-up messages to come up and help direct people to, or users to, resources that we have access to. So they could be on Google, for example, looking for, guidelines on XYZ, and this pop-up message will automatically help direct them to resources that the e-library have access to, or open access resources. So it's and it's only academic resources that will be through that plugin. So to really help direct users without needing the confidence necessarily to go and find it themselves. Of course, we'll still be working on that. We think it's really important that our users know how to find the information, but this will just be a useful tool, especially for user groups like the social workers. You know, they're new to the e-library, but we think that will be a really fantastic tool to help with that. So I'm sorry, I hope that answers your question.
Thank you, Jessica. Ro, did you want to come back? Itchy to come
I
back?
think it's worth following up with maybe Jessica and Rydian in more depth, but I think that's probably enough for the board meeting. Otherwise, we'll consume all the time chatting on that point.
Okay, Helen, and then
Definitely.
Andrew, and then Marilyn. Helen.
Thank you, Chair, and thank you, Jess. Excellent presentation, really helpful. And thank you to you and the team. And I think the e-library service has gone from strength to strength over the last few years. So I think it's achieved some fantastic things. And congratulations to Team Wales, actually, on the Team of the Year award from CILIP as well. I think that's a really good accolade. And I think the resources and the engagement actually kind of, that's why, isn't it? That we're doing some really great stuff in Wales. Marion pinched my question, actually. So, and I am conscious that you are fairly new into your interim position as well. So this may be an unfair question. So if you don't know the answer, that's fine, but we can follow up after. But I was just wondering, what's the most popular, which areas are the most popular kind of resources that people access across Wales?
I don't think I could give you an accurate answer, but I do think that's a really good point. And I'm sure my team would know that, but I will definitely follow up with you on that one. And maybe we could do a form of news item or something like that on our website to, top 5 resources or did you know we've got these, that kind of thing. So yeah, no, that's a good point, and we'll follow up on that.
That's great. Thank you, Jess.
Thank you.
Done.
Andrew. Oh, we can't hear you, Andrew. But again, you're not sure. Oh, that's it. Perfect.
Apologies. Welcome to Digital Health and Care Wales, by the way. And yeah, somebody who uses the library professionally, I just wanted to compliment the work of the e-library service. And I recommend the members to have a look what's available. It really is a wealth of information. There's a lot of resources you can request texts if you want to. So it was just to say that really, and just acknowledge that everybody is really enjoying the experience of having a new library service, and we watch with interest as it develops further, because it really is brilliant.
Thank you, Andrew.
Thank you.
Marilyn and then Ruth.
Bore da, Jessica. Thanks, Chair, and thanks, Jessica, for that great presentation. I was just wondering, on reading the information, I was wondering, you talked about lived experiences, and I've got a background in equality and diversity. I was just wondering, and I know you're fairly new, but going forward, whether there might be any work we do in identifying any gaps we have within the information that we've got, to try to sort of expand the library in some ways, because when there's been reports highlighted, for instance, recently with the COVID-19 Welsh Assembly Government report, it talked about disproportionality around health for people from Black, Asian and minority ethnic communities. So I'm just wondering, the lived experiences, whether there's any work that we could do with DHCW and just sort of highlighting that and getting the information out, like you said, to people, and encouraging people to get that information so that we can add those medical information to clinicians and people who work for us. So.
No, that's a really, really good point. I really like that. And I can't give you an answer right now, but I would love to follow up with you on that. So I've jotted down your name to follow up on that one. But a really interesting point. Thank you.
Indeed.
Happy to do that as well, Jessica. Thank you.
Fab.
Yeah.
And it's almost like one of those ways you could use that pop-up functionality, isn't it, in terms of pushing that sort of information to people that they might not otherwise be aware of. Ruth.
Thanks, Jessica. That was a really interesting presentation, and again, I commend the work that's been done. Just to change the mood slightly, I just wanted to finish on the finance side of this. I think we need to recognise that as well as the time and effort put into this, there is a significant investment that we're making on behalf of the NHS in Wales to support the wider system. We know we've seen at the board procurements for some of the journals and some of the systems that Michelle has brought forward to us. So I just thought it was worth recognising that this is an investment that we make on behalf of the NHS in Wales, and we should make sure we recognise that, as well as recognising all the good work that's gone into this.
Yes, and from my recollection, we did it last year, didn't we? And it's not an insignificant investment, but a good investment. And Andrew, did you want to come back in?
Marion said something, and I'm sorry, Marilyn said something, and it triggered something off in my mind. There's a lot of resources out there that are procured directly by services, and this brings me back to a conversation I had with the library service before you started, and it might be really good to bring those in centrally, because some of them are really expensive to buy as an organisation separately. But if the library service was to buy that or procure that centrally, it could be available to a greater number of users. So it's just a point to make, really. There's one particular product I had in mind that would be useful to us, but it costs a lot of money.
No, I definitely welcome conversations about that. We really like to have recommendations, and if we can have a once for Wales with our procurements, then we're definitely in favour of that. So no, I'd welcome conversations from everybody with any recommendations, because we have our robust governance structure, we have our robust procurement process, so we can make sure that any recommendations go through all of that. But obviously we need the recommendations from everybody to know that we're getting the right things for our users and our staff who are users as well. So no, we'd definitely welcome those conversations. Thank you.
No, that makes all sorts of sense, and picking up on Ruth's point, if we take over the procurement of an item, then we ought to be taking over the funding of it from wherever it was originally. Claire.
I just wanted to qualify the amount. So just for everyone's knowledge, Welsh Government fund us 4.4 million annually directly to fund this resource. So it's something that as an organisation we took on responsibility for from HCIW. So it's something that we do on behalf of Welsh Government.
Thank you, Claire. Any other questions or points? I just got one, Jessica, because I've already used the QR code and poop straight through on my phone. But so where does that mean we are in the single sign-on then? I'm a bit confused. If I can go straight through on my phone into the library via the QR code, then that's signed me in already. Is it automatically? Is that how it's worked?
So it was the on library search. So on the slide with the collections, if you access through library search, there's an option on there to sign in with your NADEX, your NHS credentials. If you accessed it directly, there should be an option on that resource for institution login or Open Athens login. It's slightly different wording on each resource, and that's where you can again do your same login details that way. Sorry,
Right,
I don't think I was very clear on my
I'll have to
access is control.
I'll have to
control. Sure.
Yeah, I'm gonna have to practice and explore it.
You can land on the page, but when you choose an article, when to see the article, that's the point where the
that's the point at which it will ask me to log in. Okay.
And if you haven't yet, it should prompt you at that point on the resource. If you haven't gone to the institution login, it will prompt you, so you'll be aware.
I like a good e-library. Jessica, that was really fascinating, informative, and hugely useful. And I hope we all explore the resources that are available in the library. I shall certainly be having a little play around in it later on today. So Jessica, thank you very much indeed for the presentation, and good luck in what is obviously a relatively new role for yourself.
Yeah, started last month.
Oh, well, so good luck. Congratulations. Anything else you wanted to pick up on, Rydian, before we move on?
No, just to remind our listeners, EHL, so the Electronic Health Library, .nhs.wales, available to health and social care workers across Wales.
Thank you. Thank you. So if we move on then to my report, and just to ensure the sort of the smooth running of the board meetings, that when those of us who are picking up on written reports or written reports of committee meetings or minutes of committee meetings, then they're obviously there for everyone to read in full in the papers. So I think what makes it all sorts of sense is to pick out some specific issues that are really we'd like to draw to your attention from the reports or from the minutes. And I've got three I'd just like to focus on today from my report. The first is the Senedd Health and Social Care Committee and the Public Administration and Public Accounts Committee attendance review inquiry that we attended towards the end of last month. That was attended. I think we had. I reported in my last the last meeting. It was just about to happen. It was on the 26th of October, as I recall. So myself, Helen, Rydian, and Claire attended that for what was a long session. It ran over time, and I think we were pleased with the level of interest in our work and the sorts of areas that were being explored. And I think we were comfortable that we were able to get across some key messages about the extent of the work that we're doing and the importance of the digital developments in health and care. And I think we all ended up, both committees and ourselves, on exactly the same page in respect of fax machines, that we wish to see the back of them. And interestingly enough, Ofcom have currently consulting on switching off the requirements to for the telephony suppliers, BT mainly, to supply fax enabled telephone lines. So we just finally on this point, there are a number of areas that we're following up individually with specific MSs who had particular areas of interest, and I've got a meeting with one of those prior to Christmas with a couple of our officers to discuss issues around data and the use of artificial intelligence. And we're also picking up on a number of areas where they asked us to go back with further information. So the committee inquiry, the joint committee inquiry has opened doors for us. I think very useful doors for us to have conversations around the priorities and the importance of digital developments in health and care in the future. The second bit I wanted to highlight was in my report is that a digital program governance review has now kicked off, which is now a jointly commissioned review by ourselves and the Welsh Government, being led by an individual called Steve Coombe, who was until fairly recently the board secretary at Swansea Bay Health Board, and he also, as I understand it, provided a lot of support setting up the governance structures around DHCW itself when it was being formed. And this is going to look at the way in which the various programs, that considerable number of programs that are being run on specific digital applications, how they fit into the wider governance structure, into our governance structure, and looking at the roles and accountabilities of individuals and organizations like the program boards and the SROs. So that we're hoping, and Chris will nod, that will be a quick piece of work, and we are expecting a report with luck this side of Christmas, I think, isn't it, Chris? Yeah, with this side of Christmas, that we can have a conversation with the Welsh Government about early in the new year as to how we might follow up on the observations that Steve Coombe reaches in that review. And finally, Helen and myself attended a meeting with the Minister yesterday, and as you would expect, there was a considerable focus on the pressures that the system is currently under, both in terms of winter pressures and in terms of backlog around planned care. A considerable focus on that, and a recognition that lots has been done that has already had an impact, and that things would be potentially much greater, in a much poorer state than they currently are, had those things not been done. But the bit I wanted to highlight was that the Minister a couple of meetings ago asked for digital to go on the agenda, so it was on the agenda yesterday, and Helen gave a presentation, and the critical thing here was that this was a presentation very much not in DHCW priorities for digital future in health and care, but the system priorities for a digital future in health and care. And I was encouraged, I think, by the number of chairs who picked up on the fact that it was a system issue for them, and that there were system difficulties and challenges in securing the levels of investment that are needed to really ensure that digital does have plays a full part in the future in health and care. So I thank Helen for the presentation. She did the heavy lifting on this one yesterday, but we were able to get some key messages across, I think, around our priorities and those being shared across the system. So those are the three bits I wanted to pick out. If anyone's got any questions on the wider report, please do put your hand up, or if anyone's got any points they'd like to make on those three that I've just highlighted, then again, please put your hand up. If not, I'll move on to the next item of the agenda, having asked you to note the content of my report. Okay, thank you very much. If I could now invite you, Helen, to present your report. Yeah, please.
Thank you, Chair. And yeah, similarly, just to pull out some highlights then, because colleagues will have seen the report in the papers. Just to say that 2.2, the item concerning link and risk, is on the agenda, so I won't cover that in my update because Michelle will cover that later. So if you go down to 2.11, I really wanted to call out the great work that the team's involved in our recertification of 2 of our ISO standards, our quality standards. We achieved recertification this month, so ISO 9001, which is quality management systems, and ISO 14001, which is environment management system, sorry. So yeah, really well done to the teams involved in that, and really good accolade to get that recertification. 2.12, I am extremely pleased to inform the board that we have had a successful implementation of the digital health and care record into the Velindre Cancer Centre. That was, we're in the second week of that, so that went live on the 14th of November. And we had a exec-to-exec discussion actually with colleagues at Velindre NHS Trust yesterday. So really great work that's been happening across the teams. And And actually, I think one of the reflections, and the teams are continuing to work through the bedding in and, you know, any sort of new process issues and that need to happen. But I think the greatest feedback that we've had is it was very difficult to identify who was a DHCW member of the team and who was a Velindre member of the team. So they really came as one and have worked around the clock to make that a success. Lots more work to do to get the system bedded in, but yeah, there were lots of smiles on the call yesterday, and so I just want to say thanks to our colleagues at Velindre for all of the hard work that they've done and all of that process redesign that has been taken forward there. So, and thanks to our teams for a huge amount of effort that's gone on right across kind of numerous teams in the organisation to make sure that we could get this over the line. And then I'd also like to call out 2.15. We have won the best place to work in IT in the UK from the British Computer Society UK IT Industry Award. So I am tremendously proud, actually, that the organisation has been recognised for that. There was huge competition and quite a lot of people on the shortlist as well, and some big players there. So I'm really, really, really pleased. We were commended for our commitment to diversity and inclusion and the development of our skills and career development for our staff. So yeah, huge well done to all of the teams in DHCW for that one, and particularly to call out Sarah James' team in terms of the work that they've been doing to support that from a people and OD perspective. And then just finally on the awards, just like to call out Ridian's team. So a couple of recognitions for Ridian's team over the last few weeks. They had a recognition award at the recent Health Data Forum for the great work that they were showcasing that we're taking forward in Wales. So I think that was a really, really good recognition of that. And then hot off the press from yesterday evening, the HET Innovation Excellence Awards, I think they're called, but the team who have been working on the looked after children data have won 2 of the awards. They were shortlisted in 2 categories, so they won the Best Integrated Care Collaboration. And I think my favourite award title, they won That Will Never Work award. So the most creative and disruptive solution. So fantastic achievement for the team there. And they look very glamorous on the pictures that I saw last night. So yeah, huge congratulations, and hopefully they enjoyed the celebrations. But yeah, very proud of them. So just wanted to share that with the board. Thank you, Chair. Happy to take questions.
Thank you, Helen. And if anyone's listening from a social media channel that used to work at a social media channel, this is the place to work. Rowan.
Just a comment really, Helen, you know, the work that's going on at Velindre. I just wanted to reflect really on Ridian's leadership. It's a phenomenally complex project. Ridian, it's been one of the highest risks that the organisation is carrying, and I think you've done a tremendous job. I know we're at the beginning of the mountain. There's still a lot more to do, but I think just steering what is an incredibly difficult program of work, and the skill in which, that, to Helen's point, we've been able to bring the clinical community with us is tremendous. So I just wanted to take the opportunity to say that, Ridian, well done.
No, absolutely, it's a hugely important step forward, isn't it? And as you say, Rowan, the start of a journey that I'm sure will be completed equally as successfully over the coming months. Anyone else got any questions or comments on Helen's report before I suggest we take a brief break? Okay, if we take a 15-minute break, so it's now 10:02, so I suggest we come back at 11:05. If people could switch off their cameras and microphones and then be back here at a moment before 11:05. Thank you very much.
It was doing that with me the other day. My face wasn't showing again, but mine's working now. It was doing that with me the other day. It wasn't. I restarted Teams. I did ridiculously when my camera disappeared earlier in the week because I was using Zoom. Yeah.
Diolch Simon. Diolch Simon. Bore da. Well, as we all know, COVID and working from home for most has meant that we have completely changed the way that we work. And that has really led to what we do in DHCW, which is a hybrid way of working. And what that has meant for us is we've seen a significant reduction in the use of our office space and office capacity. And my role as leading of corporate services together with our estates team led by Julie Ash is really to look at how do we best provide constructive and effective digital space for us as a team to work in. What has happened during COVID though is that the Cardiff office has become a central hub, not just for DHCW, but for other organisations and peer groups across Wales. And we saw that only last Friday when we held in our innovation space, both the Directors of Finance and the Directors of Digital meeting, which was very effective. But equally, as Marion will know, Andrew, through the Audit Committee, we've also developed our decarbonisation plan. And as we know, the estates plays a key aspect of our footprint and a key contributor to our CO2. So we find ourselves with an underutilised estate, a backdrop of rising energy costs and energy pressures, but equally, the space that we currently have doesn't really fit the new organisation and the way we want to express ourselves in terms of being a digital, innovative and exciting place to work, designed to enable that to happen in the most effective way. So the space that we currently have, we've inherited, and we really feel that we want to stamp our identity and make it serviceable to a new digital organisation and a new ways of working. So our current footprint is 6 offices across Wales, again managed by the corporate services team. And the aim of this report was really to highlight that current footprint, to look at its usage, its costs, and to consider then, given the backdrop of a new organisation, a new digital organisation with a new hybrid way of working that needs to demonstrate a sympathetic and appropriate CO2 footprint, and also to consider the opportunities of when we could migrate to that service in line with some of our contract arrangements. We laid out our estates plan for the next 3 years, which is really up for the board for approval. And what that plan recommends is really to modernise our offices or our hub within T Glanrafon in Cardiff for this financial year, to really provide that environment to suit a modern collaborative working space, but also to work in consultation with our staff to redesign our footprint and to consider the current usage and look at opportunities to change the occupancy in some of our key footprint areas, and also to work and look at new alternatives. So what we've also seen during the COVID is opportunities with partner organisations and together with shared services to have local hub arrangements to meet and collaborate together in conjunction with our Microsoft Teams. So if then after our consultation process that we decide to exit some of our key offices, then obviously that would be done in collaboration and consultation with the staff and also with our trade union representatives. But we thought it was important to present the board our plan, the motives for that plan, and to ask you agree and approve the recommendations to move forward with that in mind. So I'm happy to take any questions on the documents that we've presented this morning.
Diolch, Claire. I did have a question planned, but Claire actually picked it up when she spoke about consultation with staff, because I think the important thing is this is about us having the right working environment for our staff, so that we can deliver what we need to deliver in the right way. So it's not about we need to just get a complete change or anything like that. It's about we need to have the best environment possible. So in terms of our assumptions, one of my assumptions would be that would be a two-way conversation that we're having with people who work in those environments, because actually people need different things, particularly in a flexible working space, that we might not understand, given that most of the business we do is fully online. But actually when you're working more in that hybrid way on a weekly basis, it's about that conversation with our staff. So I was pleased to hear that Claire picked that up. Thank you.
Yes, thanks indeed for the presentation of the thinking behind this as well, Claire. I was very interested in the potential for co-location, recognizing how important it is that we are both seen and recognized for who we are. We're also living through very challenging economic times that the whole of the public sector is working through, and it potentially plays well into that, and important to do so. But almost more important than those factors, it seems to me, is being able to be on a day-to-day basis, outward looking within the broader system of the public sector within Wales. So making those day-to-day connections with other key organisations seems to me something that could be extremely beneficial for our organisation through our staff, and equally through our potential partner organisations. So I'm very interested in how that could develop, and it's clearly not set out in the details today, but it's certainly something I'll be interested to see how that develops. And would definitely say that the point about it not only being NHS organisations, but the wider public sector bodies, I'd encourage that. They are themselves looking for, in many cases, looking for co-location or partner organizations to be very connected with. And I think that's a very interesting development. So thanks for setting it out.
Thank you. Just following on from what Alistair said, really, about looking at the collaboration of potential people we could work with, and also looking at the potential of people that who might come to us in the future. So as well as just looking at we currently employ, looking at the future employees as to the way we work, whether there might be any barriers for them, or whether we might have to change slightly to encourage people who don't currently work for us. For instance, I know for my public sector partners, people who are employed at the moment, I noticed from the records it said more people were coming into the office, and that's something that I think has been seen across the board. So it might be that some people who want to work with us want to do more of the actual physical location rather than the hybrid, because their home circumstances and their financial positions. So I just wanted to flag that bit up.
Microphone. So just supporting what's gone before, and to reflect on this is a conversation that's going on in workplaces across the UK. I know, one very large marquee corporate that has already sort of decided on sort of 4 modes of working. So, there are the corporate offices. They expect people to be in the office on average, maybe just 1 day a week. But there'll be home working if that's the safest and most appropriate place for colleagues to be based, but also exploring things like memberships of some of the flexible office spaces where perhaps we can know that we've got an ability to book meeting rooms around the country nearer some of our collaboration organizations, and then recognizing maybe it's a coffee shop. I'm a little bit more unconvinced about that, given the subject matter of what we discuss, and the need for patient privacy. But I think we are working in a much more flexible age. And Claire, I commend you and the team for starting the conversation, and I'm sure Andrew and all the other colleagues will lean into this to build a better and more flexible solution. So yes, I'm very happy to approve and look forward to the outcome.
It was just to say really that we look forward to continued collaboration around this, and we are very much aware and involved at the moment. And I think it could present many opportunities. Actually, it's not to work in a very different way, make more local places available to people as well as their home base, and at the same time have attractive accommodation that we might that will be able to champion what we do.
So I just wanted to say we really want to design collectively the right space to retain that title of the best place to work in IT. So we attract the right skills, but also going to Marilyn's point, it's a hub, so anyone can join and have the right conversations. But again, I think it's important that we are proactive, we have the conversations, and we design the space collectively, and hopefully that might really win awards in itself. But it's really now we've gone to a new era post-COVID, is really trying to ensure that the working space works for us. And I look forward to doing that. Thank you, Chair.
Thanks very much, Simon. Good morning, everybody. There's a paper in the pack which has the latest information about our project to transfer one of the data centres that we have to a new location. To go alongside this, I wanted to share some information with the board about our data centres to make it easier to understand as to what the project is trying to do. So if I could have the next slide, please. We have 2 data centres in order to ensure high availability and resilience. And our systems are located in the 2 data centers so that we are able to keep delivering digital services if there were to be a problem with one of the 2 services, and also to enable us to undertake maintenance work without there being an impact on the digital services. The data centers are secure locations that have power and cooling facilities that are very resilient. The processing, the servers and so forth are different, and these are located in the data center, but we are able to move them between the data centers, and this is our plan with this project. So the first data center that we have, data center 1, is a new facility that we moved into last year, and it has a new modern network as well. So data center 2 then, which is the one we're talking about here today, is an older facility, and the network is also aged. But more importantly than anything, it's the current hosting contract we have is coming to an end in June of next year. So we've put together a project for the transition of data center 2, and the scope of that project is to procure a new replacement data center facility, then agree on an extension period for the current data center, because we will not have moved out before June. And that has been agreed by the current supplier. And we will then build a new network, a new facility, and finally we'll move the equipment, the servers and so forth into the new facility. Next slide, please. So this is a picture of the inside of one of our data centers. As you can see, there are rows of cabinets, and that's what you can see on the left-hand side there. Then on the right-hand side, you're able to see that these are full of equipment that process and store our data. So they are the servers for the network, the firewalls, and so forth. Next slide, please. So on this slide, we've got some information about the procurement process for the replacement data center and what was important to us and so forth. So the intention is that the contract will be awarded in December, so in a few weeks' time. So listed on the slide here also are some of the things that were important to us as an organization. So I'll go through these to explain a little bit more about them. Firstly, the location of the data center. We have to be close enough to the other center that we have to enable us to have very quick network connections, but not too close that a problem in the area could impact on both centers at the same time. Also, we want it to be somewhere which where our workers could travel quickly enough to, if there was a problem, if there was a need for maintenance work to be undertaken there. The second important thing then is the physical security of the space. So to ensure that the equipment that we have in there is kept safe and secure. The power and cooling systems need to be resilient. The energy efficiency, and Claire's already touched upon that a little bit in terms of our offices and so forth. But this is really important to us in data centers. And this comes from both sides of the coin in terms of the environmental point of view and the energy cost. To give you some idea, the data center uses about the same amount of electricity as some 400 houses. And then network connectivity is particularly important. There's a good network connectivity, the PSBA. So this is the network that is used by the public sector in Wales. And the PSBA is what connects the data centers to the hospitals and the GP surgeries across Wales. And then, of course, it's also important to bear in mind the costs for the facility itself and also the energy costs that we use within the facilities. We also had some requirements in terms of the migration process and costs, so things in terms of the cost of moving the equipment. And we were also looking for mechanisms to reduce the dual running costs that we have, because we'll need to keep the 2 data centers running, the old and the replacement center running for a number of months, in order for us to be able to set up the new network, test the network, and then migrate the equipment that we have over a period of some 2 months or so. Next slide, please. So a little bit of information here then about the replacement network. So the majority of you will remember that we ordered the new network back in June of this year. We had some concern at the time that the equipment was not going to be able to be delivered by the end of the financial year in March. But I'm pleased to be able to tell you now that we expect all the equipment to come in before the end of March. In addition to this, we have White Spider. They are a third-party consultant. They've been procured to support our team with the design, operation and testing work in the network before we transfer the servers across. They were the ones who undertook the work when we put the new network into the other data center last year. Next slide, please. So a little bit of information here then about the project plan. So the plan has been created using the lessons learned from the project to move Data Center 1 last year. So that went very well, and the intention is to repeat and replicate the majority of the activities and then improve the others. The first step that has already been undertaken is to audit the infrastructure that we currently have. That's already concluded, as I say, and so the team are proceeding now to the design, implementation and testing work on the replacement network once we have bought the new data center. So another major part of the preparation work is engagement with the different stakeholders that we have to get them ready to move the systems. For example, I can say that one of the companies that to provide the GP systems, their servers reside in our data centers. So another important part of this is to test the resilience of our systems so that we can reduce any risk of problems when we move the equipment across. Then there's the process of transition, and we estimate that this will take place between September and November of next year. And the final stage then will be to test the resilience once again, once the transition of equipment has taken place, so that we know that things work as we've anticipated. And some of this will be done within the scope of the project, and the rest of it will be picked up by the annual resilience program that we have. Next slide, please. So the next steps we have then are to award the contract for the replacement data center if the board agrees to do so today. Work then with the new data center supplier to agree on dates by which the facility will be ready. And we can start then preparing our network and then submitting a business justification case to Welsh Government for the funding for the requirements of the project and of course the operational requirements, i.e. the costs in terms of dual running of the two data centers. And the final part then is to confirm the project plan milestones and communicate those key dates to the stakeholders we have, both internally and externally to DHCW. Thanks very much indeed. I'm very happy to take any questions.
Thank you, Carwyn. And David, I can see you've got your hand up.
Thanks, Simon. Thanks, Carwyn, for the briefing. A couple of questions, if I may. This looks similar to the data center move that we did successfully previously. Are there any differences in terms of the timescale we're trying to do this in, or any complexities around the scope, or is it pretty much the same scope, same sort of program plan that we have for this? Great, thanks, Carly. Supplementary, if I may, Claire has previously highlighted some concern around the risk of digital inflation and the fact that we need to secure the budget for that. Is there any risk of the costs for this going beyond what's government are expecting?
What I would say, David, is that Cowan, together with his financial business partner, who also worked on the previous move, have done a detailed analysis and comparison between where we are now and where we will be post the implementation of this. But as Cowan's already alluded to, there are some costs inevitably now have gone up as a result of inflation, general inflation, and the one that we are keeping a very close eye on is the energy one. So yeah, we're working collectively on that to ensure that we budget and plan correctly.
Thank you, Claire. Alistair and then Marion.
Thank you, Chair. Slightly broader question. We are looking at a range of things on our agenda today and on our other meetings during the year, which individually are extremely sensible things that we do and extremely important things that we do. I think it would be really good that we see how they join up and that they connect to be part of our plan for the year. And I think it's really good that we see the first item in terms of impact assessment on our reports is strategic objective. I feel it's a little general the way we deal with this, and that it would be really good to be able to, as we look at different items on our agenda, to be able to identify that this particular action that we're planning on taking, which may well carry significant budget implications, is, for example, critical, non-critical, is part of our 2022-23 core plan, whether it's maintenance and operational. I feel that we're kind of a bit processy in the way we're just saying, okay, it's part of a broader strategic objective. I get that, but it would be, I think, really important to see how what we do during the year actually adds up to and connects with the objectives and plan that we start out with the year. And equally, to be able to identify within our financial outline that this item that we might be approving or considering is within budget or other aspects of that. I think it's a little general just now. So a slightly broader point, but it's something maybe we can give some consideration to.
Thank you, Alistair. Ruth. Yeah, Ruth.
Thanks, Karen. You touched on it briefly in an answer to David's question, but talk to me about our carbon footprint and what this does for that. I assume if we're within the same building, actually, there's limited stuff we can do to reduce our footprint other than moving into more efficient hardware.
It's good. Good. Thanks, Carwyn. Rowan.
Just really to echo Carwyn's point that with the data center, it's usually the cooling piece that is the controllable way of reducing carbon, and the technology that's used to provide the cooling, and whether you can recover energy for a benefit that's adjacent, which is not very often the case. But Carwyn, I think it's a great plan. You delivered the last one beautifully. You know, you set a high bar. We expect you to meet it again.
Thanks, Rowan. Ridian, you wants to come in.
Just a quick thank you, Chair, for the work they did last time and the work that they'll do in the future. The fact that the clinical workforce didn't know it was going on is a testament to the skills of those involved. It is important that we understand that keeping the lights on is the number one primary objective. It's a 24/7, 365 service, and I'm really grateful for the effort and the extra effort that the teams make, particularly when they're transitioning services.
Thank you, Ridian. Go on, Claire.
Final point for me is we've really focused on addressing our legacy debt in terms of our operational technical base. And we were commenting yesterday, we met as a team yesterday, how much our conversation has moved on from the reliability around our data centers to actually into more of the development space. And that's the backdrop of actually moving on and investing in some of these key areas. This is really probably the final step in that process, because we're now got obviously a real priority of moving to cloud. And I think this will actually enable us to move that conversation on further into how do we use that technology to create value with the digital products it will serve. So for me, this is the final sort of step in the data center journey that has actually dominated our conversations and our actions and activities over a period of time. And that will enable us to then take the next step forward, which is to go to cloud. So I fully support this, and we've worked quite hard behind the scenes to ensure that we do that in the most cost-effective way and minimize the impact on the organization. So it's a great next step.
Thank you, Claire. And thank you for taking us through the what the next steps are going to be, Carwyn, in a way even I could understand, and echo everyone's comments around the wonderful way the transfer was done previously, and that's setting the bar for you doing it this time. Absolutely. Get it right first, get it right second. Now we've been asked to note that report. The actual procurement approval we'll come on to in a moment. So if I then move on to that item, the strategic procurement report, I'll ask Ivan Evans, the Exec Director of Strategy, to introduce it, but I know he's been joined and I can see she's joined us. Welcome, Michelle, who will no doubt take us through the detail, but over to you first, Ivan.
Thanks very much, Simon. It's a pleasure for me to introduce Michelle for the next two items, to be honest. So she'll be presenting on strategic procurement, and then following on from that, there'll be an update on Link and RISP. So I'll hand over to Michelle's safe hands for the next item.
Thank you, Ivan. Good morning. So there are 3 contracts outlined in the strategic procurement report. So I won't go through all the detail because that is included in the report. I'm just going to call out a few key things as we go through for the information of the board. The first thing, just to be very clear from the perspective of approvals, we've notified all 3 contracts to Welsh Government. So that is under the requirement to notify them of our intention to enter into a contract. We are waiting for a response from Welsh Government at this point. I'm sure they're working on it. Simon, I'm asking for approval from the board, subject to us receiving that confirmation, which obviously we would then notify to you so that we were clear that that was all in place before we action any contract awards. So I'll take these one at a time, as I usually do. So the first is actually a call-off order. So this is under an existing framework that we operate as an organisation. So the framework is with Trustmark. Trustmark are our appointed Microsoft license resellers. and we are calling off some Microsoft services from that agreement. This is actually around software assurance and ensuring that we've got the right licenses in place to support our server environment. So I think to Alistair's point, this is about maintaining services really and ensuring that we can continue to operate our server estate in the way that we need to. And this is a 3-year contract that we're seeking to enter into at a value of about £1.1 million.
Sorry, apologies. You realize you're going to stop and at each one, but that makes sense. People happy to approve that one? With this first one and the last one, it always amazes me in a contract of just over 1.1 million, you get to the 51p. But I'm sure it's very important, that 51p.
Attention to detail.
It's not you, in terms of the tender, I was thinking. Thank you. If you want to move on to the next one then, Michelle.
Yes, thank you. So the next one, really helpfully introduced by Carwyn. Actually, this is the Data Center 2 services that Carwyn was just explaining to the board. We're proposing to enter into a contract. Just by way of context to that, the contractor that we're proposing to award to is a company called CDW. CDW are the prime contractor in this situation. CDW are also the prime contractors for our other data center facility, but the services themselves are provided through subcontract arrangement by more local companies. So we have got diversity in terms of the way in which those are delivered. And we are putting measures into the agreement to make sure that we've got sufficient provisions in place to reflect the fact that we're actually working with one contractor at the prime across both. We're proposing to award a framework agreement. So the reason that we're doing that is that this enables potentially other health boards or trusts in Wales, if they wish to do so, to call off services from the agreement, so to benefit from the data centre capacity, or indeed for Digital Health and Care Wales to call off services. And as Carwyn explained to us, within this award, there is also a call off provision for our purposes to host our services. And we're proposing that we do that for a 5-year period. So all of the values in the paper, I just wanted to be really clear, are maximum values, as they usually are. We've put a maximum value on the framework and we've put a maximum value in terms of the DHCW call off. Carwyn explained about the power, which obviously is a little bit tricky at the moment in terms of values, but also our overall strategic plan, which is obviously to reduce our kind of data center capacity and our move to cloud. So we would hope over that period we would see a reduction, and the contract has been structured in such a way that we can reduce the number of racks. So we're starting with 44, that's our core call off to provide the capacity that we need on day one. But the plan is that that would reduce over time, and therefore I would expect the values to come down. But we're putting that in really so that we've got that resilience there should we need it. Again, as I said, Carwyn explained this very well. This is an internal procurement really to maintain services that we provide to the health boards and trusts, and has been overseen by Carwyn and his team. So I'm seeking approval to award that one.
Thank you, Michelle. Any questions or comments? No, it looks like people are happy to approve that. And the final one.
Thank you. So the final one is for checkpoint support. So the checkpoint firewalls as part of our cybersecurity infrastructure, very important to the organisation in terms of the way we protect the services that we're delivering to the health boards and trust. Again, this would be an operational service or maintaining operational services securely. We're proposing to award to a company called Insight. Again, Insight are a prime contractor. The service itself is delivered by a company called SEP2. So SEP2 are the certified checkpoint partner really who deliver with us. We've been working with SEP2 as an organisation for a number of years now, and they've delivered very good services to us, particularly in this area around our firewalls. So this is quite a helpful outcome, I think, from the perspective of the team, that we know that we can rely on them to deliver the level of service and resilience that we need. So again, this is a 3-year contract that we propose would start on the 1st of December, and the maximum value of that for the support that they provide, and potentially there's an option in there for some additional services should we wish to call them off around audit or other services. And I think experience in recent times has shown that we may want to call off some additional cybersecurity support from some of our expert partners. We've built some capacity into the agreement to do that should we wish to do so. So also seeking approval to award that one.
Thank you, Michelle. And again, you have the board's approval on that one. Thank you for that, but obviously you're not going away, Michelle, because you've got a starring role in the next item. So thank you. We move on then to item 5.4, which is around the transfer of a number of digital programs from the NHS Collaborative to ourselves. And I think Helen. Sorry, Ivan, someone's shouting.
Thank you, Simon.
Oh, sorry.
No, it's okay. I just wanted to take the opportunity to say thank you to Michelle and the commercial team for the work that they've put in. The board will be familiar with these procurement reports. They are delivered and presented in a very assured and tidy and clear way. It's a relatively small team, the commercial team, and I think that they do fantastic work. And I also want to pay attention to the fact that they do more than simply procurement, because there is contract management work, there is relationship development work with suppliers, and there is an awful lot of other work that goes on that the board doesn't necessarily see in the same way. So we just want to take the opportunity to say thank you to Michelle and also to the team. It's a very important team within the organisation.
Absolutely, and I'm sure we'd all endorse that. Apologies, I didn't see you, Ivan. It's the dilemma of looking down and you haven't got the board secretary sitting next to you to kick you on the leg to point out that someone wants to come in. So I'm sure we'd all endorse that that appreciation. Absolutely. And then, as I said, moving on then to the next item, which is going to be introduced by Helen, and I think Michelle is obviously going to be part of the next item as well. Helen, over to you.
Thank you, Chair, and really not a lot from me. This is building on the decision that we made at the extraordinary board meeting last month to accept, if you like, the transfer of these two major digital programs, national major digital programs, from the NHS Wales Health Collaborative to Digital Health and Care Wales. That was following the decision that these programs would not transfer as part of the functions of the collaborative that are transferring into the NHS executive. So we promised that we would bring an update to this board meeting in terms of the development of that work, and actually a quick update on where we are with each of those programs. So, and I'm really grateful to Michelle, who must feel like this is taking over a full-time job at the moment, being part of all of the work that we're doing around the diagnostics agenda. So I'm really grateful for all of the in-depth work that's going on with Michelle and the team across DHCW and across the Health Collaborative and across the suppliers at the moment. But I'll hand over to Michelle. Thank you.
Thank you, Helen. So just a couple of key points again that I wanted to call out from the report. So the first I want to say, I'm really pleased to say, and noting what Helen's just said, we have appointed an interim programme director inside the organisation who I'm now working with very closely and who is leading the transition process for us. So Alison Maguire, who will be familiar to some colleagues, a really good appointment, and I'm really pleased that she's going to be taking this forward. Alison was pivotal in leading a number of programmes in response to COVID, so around contact tracing and the vaccine system. So I think she's more than up to the challenge of helping us now move forward with these programmes. So really pleased that Alison is on board. The transfer process is well underway now, having been accepted by the board. And the 2P consultation with the team in the collaborative is due to complete this week. I've been involved in a number of meetings with the folks who are transferring, and we've had a very positive feedback, I think it would be fair to say, from the team. And I think the director of the collaborative reported the same thing from his perspective. So we're really keen, as we talked about in our October meeting, really keen to welcome that new team to come and join us and to make them feel very much a part of this organisation. So that is well underway with a lot of support. Thank you from my people in OD and finance colleagues and Julie Ash from the corporate team. So we've got a bit of a team stood up and we are now managing that transfer safely into the organisation. So I want to touch a little bit on Link first. So Link, that's the laboratory system programme. So we've had the team on site in our offices in Cardiff. So that's the whole team. So that's the programme team. That would include Fix from our own organisation and the supplier. And I think that's had a real kind of drive toward the progress in that programme. It's been really helpful. We had a catch-up session yesterday, in fact, and I think I could see quite a lot of progress had been made by having the team working and very focused on what needed to be achieved within that period. So that's really good. We've got a new plan that's now being worked on, and we need to really understand that now in terms of the resources and the deliverability of that plan. I do want to be open with the board, though, that there's still quite a high level of concern actually about how deliverable this programme is. So we're not out of the woods yet. There's a lot of work to be done, and we've got a very tight timescale in order to deliver this. So, you know, keen to be open about that really, and we've been clear about that with the supplier and with the team about the things that we need to do to take that forward. And on that note, actually was really helpful. We joined the Chief Exec's meeting with Helen earlier in the week to make sure that the Health Board and Trust Chief Execs were fully up to speed in terms of where the programme is, and that they were cited in terms of the way forward that we were now proposing. So that was a joint update, which I think was helpful with the collaborative director. The programme is still with the collaborative at the moment, so it transfers on the 1st of January, but also with the SRO, who's been very helpful, who's also relatively new on board and is very keen to look at the governance and assure we've got the right mechanisms in place to move it forward. So we updated to chief executives, and I'm sure Helen will be keeping colleagues in the loop so that everyone is clear on how this is moving forward. And the other thing I just want to mention then, radiology. So radiology is the other main programme that will transfer, so RISP, which is basically the radiology information system and the PACS. That is a procurement that is underway at the moment, so it's sitting some way behind in terms of the timeline for Link. So we're just getting toward the end of the procurement, so the board should expect to hear updates on that more formally through this mechanism. But I've also asked Alison to lift the lid on that one a bit and really get an understanding of where that one is in terms of status and planning, and to work closely with the team, and she's already started to do that. And I think we need to ensure, obviously, that we take some of the lessons from Link and we make sure that we've taken those on board, and then we've got a robust plan to deliver the radiology programme going forward as well. So that one we've got a bit more work to do on, and we've to be honest, focused most of our attention on Link at the moment because of its status, but we are also very much getting into RISP and would expect to get a robust plan around that as we move forward. So that was my update. Really happy to take any questions from the board.
Thank you, Michelle. I've got one. I'll come back then. The hands were slow going up, but now they're going up. Like Rowan, and then Marion, and then David.
Marion, sorry, Michelle, it's just an observation, I think, more than anything. We'll touch on in 6.4 the corporate risk trend analysis that Chris Darling produced for the DG&S committee. You know, we have some projects or programs that we are operating where the amount of risk we're carrying is going to be much greater than the board's appetite for risk. And it's one of the ways that we make that explicit. And you know, there are a lot of pieces of this to juggle. So I think it's very important that the team and the organization gets the support it needs to be successful. We need this to be successful. And that means making sure that the budget and the talent is around the table. And I know everyone's going to have this top of mind, but I think it's just worth saying it in those terms, Michelle, that you know, it's recognized by the board that there is considerable challenge around these two programs. So thank you.
Absolutely, absolutely. Marion.
Thank you, Chair. And it's a comment really that I'd like to make more than a question, to be honest. Of course, we all as a board are entirely supportive of the transfer of this Link programme to Digital Health and Care Wales. And of course, it is an absolutely logical step in several regards. But I was pleased that Michelle referred to the level of concern that there is in terms of implementing several aspects of this programme successfully. And I think it's important that we are honest and recognise that across the journey. We hope, as Rowan has said, that this will be a successful programme ultimately, but there are major risks associated with it and the concerns continue. And I think that it's important, really important, that we don't forget those in the narrative when we present updates and reports about this programme and we talk about different elements and different stakeholders as well. I'm pleased to hear that we've appointed an assistant director for communications, and I'm sure that that individual will be able to assist us also in ensuring that the messages are clear as we move forward. Thank you.
Thank you, Marion and David.
Thanks, Simon. Thanks, Michelle, for the update. Really pleased to see that we've taken the opportunity to baseline the status of the programmes as they're transferring with the wider health board. I think that was an essential step. My question really is around ongoing updates on this programme, given the risks that you've identified. Can you just sort of outline when the board and the DG&S committee would likely get further updates on this programme as we lead up to the official transfer, which I think is 1st of January, and then subsequently to that?
Yes, really good point, David. I'm happy to provide updates, but we just need to look at that offline and think about what's the best way to do that. We've also made the same commitment to the chief executive through the collaborative executive group. So Helen, I guess we could look at, clearly we need to keep our board up to speed in the same way that we're briefing the health boards and trusts. So
yeah, and the board will recall that we're, and I think it's just about to kick off, isn't it, Chris? A rolling program of program updates for the board, so that everyone can be at the same speed. And clearly, the link RISP programs need to be fitted in that with the regularity that they need, and that might be more regular than some of the others at the moment, David, wouldn't it? Just in terms of level of risk. Helen, you want to come in?
Yeah, I just, and in terms of in the interim period between board meetings, I mean, clearly this is a standing agenda item weekly on our exec team discussions. So what I will continue to update yourself, Simon, and the IMs in our kind of informal weekly briefing sessions as well, just to ensure that the same kind of everybody is briefed in the same way as we progress through the transfer and the you know, the improvements hopefully we'll see through the programme and the programme performance.
And sorry, Michelle, go on, far away.
Sorry, Simon, I was just going to pick up on a couple of the points as well. So, because David helpfully mentions about Digital Governance and Safety Committee, obviously we report programme progress through there, and the conversation about risks. So very mindful at the moment, Link and RISP have not been programmes being run by Digital Health and Care Wales. So we've had a slightly arm's length relationship with them. And Chris and I have discussed this. As soon as the programmes transfer from January, I would expect the profile of those programmes to change within this organisation, because they will be firmly our programmes. So things like the risk register and the way we report progress through our committees, I would expect to change because they'll become more firmly into the DHCW governance arrangements properly. So we are looking at doing that already. But thank you.
Thank you, Michelle. And something occurred to me while you were speaking, I think and perhaps you, myself and Helen can discuss when the appropriate time is. I think we ought to take something into the chair's peer group as well. Yeah. Because I know in the past, over the past 12 months, that it's been an issue that's been raised within chairs, and I'm sure they're talking to their chief executives, but actually getting all the chairs together to get to hear the same thing, and would be helpful. So perhaps we can have a conversation when that might be appropriate, when the best time to do that would be next year. Thank you all very much. We're asked to note that report, and we've obviously approved the transfer, so we're noting the update from Michelle, which I'm sure people are happy to do. Thank you. And if you recall, I said right at the beginning that I was going to bring one item forwards to enable David to present any highlights from the written report you've seen there of the latest independent member network meetings, which David chairs. David, over to you.
Thanks, Simon. Yes, we had our fourth meeting back in October. We had 4 substantive items on the agenda, which are covered in the papers for the board meeting. There's 2 things I'd really like to pull out, which were, we had a presentation on the digital services for patients and public, which was very well received. The pilot is about to go live. There was some discussion about both of the GP systems that we support, being part of the pilot, and we confirmed that that was the case. There was a little bit of concern raised about the level of engagement across the GP surgeries that are involved in supporting both the pilot and the wider rollout of this. A lot of discussion which the team presenting took on board, so I think they've got some good feedback from the IM network. The other thing I wanted to pull out was we had a good briefing from the Cyber Resilience Unit, and that sparked quite a bit of discussion around the assessment that had been carried out using the cyber assessment framework, and the fact that there was a little bit of variation across the health boards and ourselves in terms of compliance with the framework. Also touched a little bit on the recent incidents around the 111 service, and there was a feeling amongst the independent members that maybe the independent members of the health authority should be doing a little bit more to raise awareness of cyber at the board levels of the health boards. And to that end, we have basically allocated a chunk of time at the next network meeting, which will be in January, to discuss how we can, between us, help facilitate and support that.
Thank you, David. Any questions or comments? I think anything that we can do through that network that keeps cybersecurity right at the top of the agenda across the system is helpful and welcomed. Rowan and then Helen.
Simon, just to say two things really. One, David chairs these meetings phenomenally well, and it's a delight to participate. I think the second thing I would say is it's a really pleasing example of the development of the organisation over the last coming up for 2 years now, I think, people, in terms of us finding our feet and being able to lean out into the wider NHS system and create top to top, peer to peer type engagement opportunities. So yeah, just hopefully this will continue, because I think at the moment it's working well and bringing value across the NHS in Wales.
Thank you, Rowan. And Helen.
Thank you. Yeah, thank you, David. I just wanted to kind of make you aware of kind of the unsolicited feedback on the IM network from a couple of the IMs, to say they're really enjoying the updates and the information that they're getting, and actually it is having an impact and changing the conversations around the board. And I think Simon, reflecting on yesterday's chairs and chief exec meeting with the minister, at least 2 of the health board chairs picked up on cyber as part of that. So I think there is definitely kind of the amount of briefing that is going on through the IM network is certainly starting to filter into those broader board discussions. So I think it's been really, really useful. So yeah, and thank you, David, for clearly all of the effort and energy that goes into chairing it.
Absolutely.
Thanks,
I'm sure we'd all.
Very pleased to know that there's some positive feedback, that we're making a little bit of an impact at the board level.
Yeah, absolutely. And echo the appreciation of the work you put and the effort you put into to chairing that group, David. Now, I probably ought to say nice things about Bill Gates to ensure that my system doesn't crashes in the lunch break. So we're going to take a lunch break now. It's 10 past, so I suggest we come back at, what's half an hour? 22, isn't it? So at 12:40, just if you could get back here a few moments before that, that would be great. If please again remember, turn your camera and your video off, your sound off, and we'll see you just a few moments before 22. Have a good lunch. Can you hear me? Brilliant. It's absolutely chucking it down here. Is it with you? Yeah. It's all right.
Hammering it down.
Yeah.
Just rain, or is it the hailstones as well?
Just rain at the moment.
Load of hailstones yesterday.
Mm. Okay. Give it a couple of moments for people to turn their cameras on. Here we come. We definitely need Ivan. Oh, there we are. Okay, that's Michelle back. I think that is everyone back. Welcome back, Panandar. If we move then into part 6 of the agenda, the governance, risk, performance and assurance part of the agenda, and 6.1 I'll ask Ivan to introduce the integrated organizational performance report. Ivan, over to you.
Thanks very much, Simon. The report is one which will be familiar to members, but we do have some new members on both sides of the board. So I just want to give you a brief summary before I present, and I trust everybody will have read the papers and the notes. So I'm not going to go through those and repeat them. We've just passed the halfway point through the year. So I'm just going to look back a little bit at the first 6 months as well and draw some things out. Before I do that, as I do on a regular basis, I would like to say thank you to the teams across the organisation for their contributions to the report. We work very hard to keep the report as concise as possible. It's about 30 pages, and we try to squeeze as much information as we possibly can into that in a clear manner, which communicates clearly where we are at in terms of our performance. But behind all of that, under the surface, there is an awful lot of work that goes into contributing the information that goes into the report. So earlier in the meeting, Alistair talked about how we bring everything together in order to see what is absolutely key, how things integrate, how things interrelate to each other. I think the IMTP process is a really important part of that. The board discussed the IMTP and how we go about that process in the previous meeting. We will be expecting to look at a draft of the IMTP in our next meeting in January. That's our main priority. But as far as possible, we do try to ensure that the performance report reflects the IMTP, and that is why you'll see the same structure in parts of it in terms of our vision and our work as an organisation, and I'll talk about that in a moment. I just want to talk a little bit about the highlights of the year. And I talk about that because, as Ridian mentioned earlier, as to moving from one data center to the other, during the presentation Carwyn gave, one of the best things about last year was that staff didn't even notice that it had happened. And that, you know, there's an awful lot that goes on, and the things that lots of teams do across the organization, working together and in close partnership with our stakeholders across the NHS, that, you know, things go smoothly. And as a result of that, it is not raised up to the board level as a risk or anything that needs additional attention. So I just want to talk about some of those things, because it has been a very busy 6 months and there are a number of significant things that have been delivered. And they feel as if they were a very long time ago, but they're actually not that long ago. So firstly, going live with the WPAS patient administration system was a major part of Betsy Cadwallader in North Wales. There was an awful lot of planning that went into that process, and that went very smoothly. The community care WCCIS system during August has gone live to 6,000 new users in an area in Bevan. Again, that's an important step in terms of the WCCIS journey. The app as part of the DSPP program is now in the process, the private beta process. There are 1,000 users working through that app, feeding detailed feedback, and it is going smoothly, and it is providing a very useful understanding to us as to how users respond to and make use of that app. You will know from the recent extraordinary meeting about the framework procurement for transformation of digital medicine a framework that has up to that's up to 100 million, even though it'll be the health boards that'll be purchasing through that, but that's an important step forward. And also, of course, all the work that Michelle has just reported on in terms of LINC and RISP, and the work that we have been undertaking with the collaborative and with those teams across months. So the transition process of work into DHCW is the culmination of the work that's taken place since very early on in the summer, and an awful lot of work has been done there. Then in this year, in this Office 365 contract and the Centre of Excellence in April, it feels longer ago than that. It was a very important step forward in terms of operating as one integrated system across the whole of Wales. And then that brings us right up to date as to what Helen was talking about earlier, about the digital health record in Velindre just a fortnight ago. And that again is a very important step. So there is an awful lot going on, and some of those things are new. And in addition, the LINC and RISP work have not been fully planned in, and the teams have to respond to that pressure during the course of the year. And the requests that we have from Welsh Government or from other stakeholders all the time in order to extend the resources that we have so that we can deliver on that. So I just wanted to talk briefly about that because we're halfway through the year. And I also want to talk about a couple of things, and I will invite Carwyn and Sarah Jane in later on just to talk about two aspects specifically in the integrated report, and then we will all be able to respond to any specific questions that independent members might have. Firstly, I just wanted to draw your attention to the fact that the report predominantly is a report on our internal performance as an organisation, but there are elements of reporting on national programmes such as WEDS or WCCIS, where decisions are made and local decisions are taken, and also on the system in its entirety. So we will report on service maintenance incidents and events at a national level, but sometimes there may be problems with those that may be a combination of local and national issues, and Karen may talk a little bit more about that. And you'll see on the dashboard one of the amber areas, which is amber again, and that is the service level agreement meetings, so the service level agreements that we have. Clearly, we and the stakeholders have to agree to that meeting. You'll all be aware how much pressure there is across the health system in its entirety at the current time, and we have found it difficult to get those meetings into the diaries. A number of them have been postponed very often or almost every time because of the pressure that exists on the delivery of the NHS, because there's huge pressure out there in the health boards, for example, and other areas. Then the final part, and I'll hand over to Carwyn and then to Sarah Jane, but I just wanted to draw attention to more or less the first part of the report, where we set out the 5 missions that we have, the 5 missions, so our vision, the 5 missions, 12 portfolios and 6 organizational objectives. They are the same as is included in the IMTP. So the idea is that that skeleton, you'll be able to see it in the IMTP, and you'll be also able to see it coming through in the IOPR. And that's part of the process of developing the IMTP for this year, so that we can do that and make it more clear and more apparent, so easier to do what Alistair was talking about, which is to look back at how we are performing against the way in which all these things overlap. There are 2 items in red in the pages that follow, and I just want to draw attention to those and say that they are red because we have not hit the timeline, not because the programme poses a red risk. So, for example, in my area, well, actually, Sam Hall's area at the moment, under WCCIS, there is a future roadmap. There is a future roadmap. I've said it in Welsh and in English there. That work is proceeding. I'd anticipated that we would have concluded that work by the end of September, by the end of Q2. The WCCIS Programme Board has been eager to work for a longer period of time with stakeholders in order to make sure that everybody understands where we are going and everybody is supportive of where we are going. And therefore, we've taken the decision to extend that work into Q3. And as a result, that comes up as a red in the report because it is a report against where we had anticipated we would be. That's what it is. That doesn't mean that work is not going on. It doesn't mean that the programme is fragile or that the programme in its entirety is red, simply that that one point is flagging it red. So I just wanted to explain that. So I will hand over now to Carwyn just to talk very briefly, I think, about some of the service maintenance incidents, and then I will invite Sarah Jane to say a word about workforce and organisational development, and then I'll welcome any questions from any members on what's in the report. Thank you, Ivan. So I'll start off. Performance in maintenance and service requests can be seen here. These service desk statistics are all good apart from the call abandon rate. This is over this target at 7.1 at the moment. This is a result of a number of additional calls as well as staff turnover, annual leave and sickness and so forth. Having said that, our current telephone system doesn't measure the calls that are left in a very good way. For example, if somebody puts the phone down after listening to the message which is pre-recorded, for example, a message to say that we are aware that there may be a problem with one of our systems. So this is counted as a call which has been abandoned, even though the caller may not have stayed in a queue for the call at all. We're currently in the process of procuring a new contact center system that will be cloud-based, running with Microsoft Teams, and this will give more useful metrics. In the meantime, we've introduced an average response speed metric, which gives a better overview of the experience the user will get when using the service desk, when they phone into the service desk. Then 6 out of the 7 of the major incidents, or the major IT incidents, are with WRIS. Now, WRIS is a software that we provide and is run on servers within the local health boards. And so those organisations are the ones that undertake most of the maintenance work and the support work, and our team takes part in resolving more complex problems. There's no one fundamental matter that's causing the problems. There were some because of problems with the web server, some because of problems with the database server, some because of network problems, and 2 in Cardiff and Vale, which are the result of the fact that they are running an older version of WRIS. And so the problems have been resolved in more up-to-date versions, so the 2.4 version or newer than that. And so all the other boards run version 2.4, and our team is already working on 2.5. So there will be a need for some particular adaptation were needed for version 2.4 for Cardiff and Vale. And that team is looking at what resources will be required to undertake that work. Also to point out, the one incident that broke the metrics we had within the 4-hour repair is to do with local network problems on one of the Betsy Cadwallader sites, so as Ysbyty Glân Clwyd Hospital. And that's all I had to say, thank you.
Is Sarah Jane coming in now?
Thank you. Yes, I'm just going to speak very quickly just about the ongoing recruitment challenges and where we are, just following the mid-year financial position. So just some figures really to sort of whet our appetite. 175 vacancies that have been filled this year to date. So there are a number of new people joining the organisation and some people moving on lateral and promotion moves within the organisation to support our grow your own commitments as part of the strategy. We've got 75 people over and above that are due to start with the organisation as brand new people joining the organisation in the next 3 months, and 82 more that we've got various recruitment activities to support them joining us, hopefully by the end of the financial year. So they're either going through the job description, or we're working through the selection process, going through a recruitment activity or interviewing, etc., but they haven't been offered yet. So we're looking by the end of the financial year, hopefully, to have brought in sort of about 230 extra people, as well as freeing up a number of different vacancies for people to move into as part of their own career development.
And just to provide some assurance to the board, there's a number of innovative assessment centres and recruitment activities and so forth with graduates, and a wide range of new talent coming into the organisation that we've just ramped up really in the last 6 months to hopefully explore new markets and encourage new people to join the organisation. And as we heard earlier, being the best place to work in IT, we will definitely be using that in our branding and our recruitment materials and so forth. And actually, joking aside, I think, that sort of thing will absolutely put us, even more on the map than we already are. So it's just going to be really quite an exciting time, continuing to work really closely with the education sector and across the digital networks and so forth, using our sort of relationships and our network contacts and other ways to try to broaden out, bringing in new people into the organisation, new talent. And I think just finally to say, obviously with the digital workforce review and a number of other things that are moving forward, that's going to give us some even further opportunities to develop career pathways, different frameworks, new ways of thinking how we're going to model certain careers and how we're going to work that across our own organisation, but also nationally across that wider family across the NHS. So lots to go after, ongoing challenges as we all know and are well rehearsed, and I won't go into that again in terms of it's a very competitive market, and we have to stand out as an employer of choice, and looking at our employee values proposition. Development's a big one in that space for us, and being a great place to work, I think, is really going to be quite encouraging. And I think we've heard different people saying that, people that are coming into the working environment are looking for perhaps different ways that they want to work and how they want to work and so forth. So we're just making sure that what we've got on offer is absolutely going to be, positive and encouraging to the diverse workforce, really, so we can have a look at different people, different skill sets, different parts of their career, different age groups and so forth, so that we can really hopefully get a really fantastic working environment long term for really talented people in the digital space. So hopefully that was an interesting quick snapshot of where we are in that issue in terms of recruitment, which I know has been an ongoing risk for the organisation for quite some time.
Thank you, Sarah Jane. Thank you, Carwyn and Eva. Can I just pick up a couple of things with you, Sarah Jane? Because bringing in that number of people in that shorter time, I mean, it's a horrible phrase this, but onboarding is quite a time-consuming exercise for managers and other team members. Is that manageable in a sense, or is that potentially, bringing this number of people in, new people in, having an impact on those people who have to support their induction, support them getting up to speed?
Yeah, there's a range of things, really. I think in terms of what everyone needs to do that is a manager, there is a percentage of time being a manager that you will need to support staff with development, onboarding, induction, appraisals, and so forth. So that should be built into, the business as usual work, really, because that's what you need to do as a manager. But you're absolutely right. Yes, it is. I mean, what we've tried to do is we've done lots of things like assessment centres, virtual and in person, and that's taken out sort of, 50 people coming for one job, and then going through a sort of an interview of 10 people and just getting the one person, because as you can understand, the amount of activity and work behind the scenes for getting one person in is huge. So yeah. Again, we've tried to work at minimizing impact of people having to be away from the workplace and so forth. But in essence, we've also had lots of support as well, coming to assessment centres with us and talking about, digital careers and so forth. And that's been really helpful for people coming to talk about, what their ideas and what their, excitement is about perhaps joining the organisation, to talk to other people in that sort of digital specialism, which has been really helpful.
Thank you, Sarah Jane. Thank you. Alistair and then Marion.
Thank you, Chair, and thanks, Ivan and Sarah Jane, for the run through of this. There's a lot of information. It's very detailed in some places, and it's I think quite navigable, which is always helpful. Just a couple of thoughts, and just following on from Simon's last question. I was going to just ask, the aspect that we've described in terms of onboarding is an organizational look at the individual, but I do wonder, are we also making space for the impressions that people have coming into the organization from the outside and capturing those early impressions, Sarah Jane, but also making space for innovation from people coming in. So not so much about the organization impressing its culture on the individuals, but actually trying to extract the benefit of new people coming in and potentially saying, well, there are better ways of doing this, or they're making space for that. The other thought was in terms of the just for the avoidance of any sense at all that we mark our own homework, I wonder, can we strengthen, and this might be one, Ivan, for the full year, and it may be something that you already have in plan, as opposed to for the half year, but strengthen the assessment of our key stakeholders and indeed of our employees in ourselves and the way that we operate, as opposed to metrics that we have of our employees, just to try and make sure we've got a balance between how we assess our own performance and how key stakeholders, employees would assess ours. So just those 2 points. Thanks, Chair.
Do you want to pick up on those points now before I come on to Marion?
I can pick up on a couple of things. I think in terms of, there's a couple of things really. We're doing quite a lot of work at the moment on recruitment branding. So I think in terms of encouraging people to understand a little bit more about our organisation, we did some filming yesterday in the office. So we were all in the boardroom. A number of different members of staff volunteered, and we hopefully shot a diverse workforce, so that we had a filming crew in, which was really exciting. So we're doing some really good work on recruitment and branding. So that digitally, we've got a really good footprint in that space. I think in terms of people all coming into the organisation, we've got both local and corporate induction. So the corporate induction is great because you make friends and you get to know people from different different areas of the workplace. And we've also introduced a new buddying arrangement where the induction group remain friends and have informal catch-ups as well, as a bit of a support network, but a friendship group. And indeed the local inductions, it's very much about the manager, talking to the new member of staff, but also making sure there is space, as you rightly say, Alistair, to encourage people to say, have you thought about this, or we've just done this, and so forth. And I think we are an open, transparent organisation. We are a listening organisation, a learning organisation, and we are really encouraging people to put ideas forward and look at new ways of working, and not just thinking it's got to be one way or it's the highway. So I think there's a really good ethos in that space, and certainly the feedback I've had from a number of new joiners have said they've really found it very welcoming. They've found that people are interested in their ideas, are listening, and also taking things on board. So I think that's been a really positive space, and lots of positive feedback in that regard. So hopefully that will provide a little bit of assurance for you, Alistair.
And just on Alistair's point about not falling into the trap of marking your own homework, and in terms of staff, I know we regularly do this, but when's the next staff the full-blown staff survey scheduled for?
Yeah, I think it's fairly imminent, really. But we also, during the course of the year, what we do is what's called pulse surveys.
Yeah.
So with the trade union representatives, we have a look at what areas we think might be hot spots, or it may be after a big change in an area, we think, well, let's have a temperature check of that area after a period of time. It might be after introducing a new policy like hybrid working or an appraisal policy or something. So we do various different pulse checks during the year, which I think sometimes are quite valuable, because we can then determine the bespoke questions to ask for our organisation, and the staff survey is more prescriptive in terms of what questions it asks. So I think sometimes the pulse surveys, for me personally, I think are really, really helpful, because we can ask sort of quite stretching questions and really get a temperature check of that in real time, and then obviously make some changes or adaptations if there's anything that needs some development and support around it.
With your forbearance, Marion, does Ivan and Helen, do you want to come in on this point before? Yeah, probably. I thought Ivan and then Helen. And sorry, Marion, I'll come back to you then. Okay, thank you. Helen.
Yeah, thank you. And I guess really building on the employee feedback, as you say, Simon, we do regular staff surveys, and there's the annual NHS staff survey. I think that perhaps what we'll do is think about how we incorporate that in a timely way into the performance reports, and which of the key metrics, I suppose, as a board, they're the ones that we'd want to see in the performance report. We spend a lot of time on that as an exec team when we get those results. I think just to, I guess, reassure you, I think one of the ones that stood out for me was, and we had quite a good take up from the survey from our staff. 85% of the staff last time they were surveyed said that they were proud to work for the organisation. So it's those sort of metrics, and we don't just look at the good ones. Actually, we'll drill down even into the small kind of numbers that we get there, where there are areas where we think there is learning for us as an organisation. But I think that's something that perhaps we need to look at surfacing perhaps more for the wider board, and we'll take that away.
Thank you, Helen. Okay, Marion, apologies for the delay.
No problem. Thank you. Thank you, Ivan and Carwyn and Sarah Jane also for your presentations. I think what we've seen this afternoon is that there is very encouraging progress that's taken place in the first 6 months of the year. And I think that it's appropriate that we as a board should recognise that and state how pleased we are to see that progress. To some extent, you've already answered, Ivan, the question I intended to raise, but I would like to follow it up anyway, and that is about WCCIS. And thank you for summarising the meaning of that red that we saw there. That's really helpful. I was eager to know a little bit more about why there's a need for the extension in terms of the period of engagement with stakeholders, because if I've understood it correctly, you know, does this body of stakeholders include all health boards that will in due course be receiving this system? And so bearing in mind that this system has been afoot, from what I remember, for perhaps 7, 8 years by now, possibly. So, you know, what is your feeling? I don't want to put you on the spot too much, but what's your feel as to how much more or how much longer we have to wait to see this engagement period coming to its conclusion where everybody is happy with the path we're taking? Well, to answer the second part first, not long, and we expect to see the result of that work before Christmas during Q3. The reason for the extension, there are 2 pieces of work that are associated. One is the strategic review, and that work was completed in Q1. And the second is, based on the strategic review, what therefore is our direction in terms of delivering over the coming years. And so there are options in that regard. And in August, as was presented to the board in a previous meeting, there was a very significant cyber incident with Advanced, a company that provides the system to WCCIS Care Director. And even though the impact of that cyber incident was on the Astra, another product, then that's clearly part of the considerations that we have in terms of the future of Care Director as a platform. And also stakeholders and the board have been eager to think not only about the technical platform, i.e. Care Director as one digital system, but also the program, the objective, the ambition of integrating services and data transfer from one place to another between health and care. So the task became a bit greater. The board was very, very keen for them to be able to have as full a conversation as possible with stakeholders, and felt that it was worth extending that period of time for about 2 months. And that is why it slipped over the programme that we had to start with. Thanks very much, Ivan. Thank you.
Thank you, Ivan. Thank you, Marion. Carwyn, then Rowan. You are. Mm. Mm. Thank you, Carwyn. Rowan and then Marilyn.
Thank you, Simon. Ivan, I enjoyed the canter about what we've done through what we've done in the last 6 months. Whenever I read this particular report, I kind of get a broad assurance. It's pretty much what I'm looking forward, for when across the various aspects of the organisation. But it did strike me as I was thinking about this report that as we look forward to some of the large programs that we're delivering, and on the front of the report, we have our performance scorecard. And there's been a couple of spaces for metrics under development for a while. And if I think through the consequences and impact of programs like the DSPP, some of the wider engagements around moving towards and delivering on a healthier Wales. Some of the things around, enabling people to engage with their data more and some of those topics. In our engagement and feedback panel, we've got 3 very clear metrics that really lean into the leadership of the service, the performance of our systems, achieving their service level agreements, and the sort of direct feedback into the loop through service desk. We don't really have anything yet that talks about the engagement with the Welsh citizen. And it just feels to me that there's a 4th corner there that we could be working on what those metrics might be and what we might be monitoring. And I certainly don't have a recommendation, but I was going to put the proverbial flea in the ear and challenge back to the exec to say, is it time that we think of filling that box, and how do we engage with the public? And Sam, I'm looking here as you've sat here and listened very carefully and let Ivan sort of throw the Wikis delay across your desk in a slight hospital pass. We're more supportive than that, of course. There's something there that I think is missing, and I would really like and welcome to see some development of that. So I'm not sure what the answer is, but I'm throwing out the question.
Do you want to come in, Ivan? Go on, and then I'll bring you in, Marilyn. one of the things that's worth mentioning is that we were told yesterday that we're going to be given an IMTP template. And what will be interesting for us is whether that template works for us or is much more designed around clinical service delivery, health boards, but we'll see. Marilyn.
And Simon, by the way, I don't have an answer to it, as I said, but I do think it's something to start thinking about. It's not a fast thing.
No.
But that it
no,
just,
right.
it was that box that started me thinking, and I just wanted to share that with colleagues.
Yeah. Marilyn and then Chris, and we better move on to make sure that Claire has enough time.
Just want to say what Lauren's just said resonated with me, because that's one of the reasons why I want to be involved with DHCW. But just going back to the earlier point when we're talking about us marking our own homework, Alistair said, it's about sometimes perhaps creating a space for people, rather than asking them questions, to have a standalone item, or for us to think about the strategy in which we allow that freedom for people to come and tell us. Because if we only ask them when we want, or if we rely on them to go, the power dimension is not quite right. So if we put in our strategy that there's something that's ongoing that we want to continually do, I think that will create a lot of more willingness for people to have that space to say what they want to say, because it doesn't feel as comfortable as we'd like to think when you're new, and compared to when you're an existing member of staff.
No, it's that open invitation approach, isn't it? Where,
yes.
Yeah, absolutely. Chris.
Yeah, it's just to respond to Rowan's point around doing more citizen-facing engagement. I think the Citizens' Voice body comes into force formally, I think, on the 1st of April 2023. I think that's a really big opportunity for us in terms of partnership working, utilising their mechanisms to engage with Welsh citizens on the digital health and care agenda. And I know, Simon, you've met with the chair already and started some of that engagement work, but something that we should be building into plans moving forward, I think can help us actually in terms of that citizen-facing work.
No, absolutely. And as people know, they've seen the correspondence that we've made it clear that when in taking on the data promise engagement work, there's a really important relationship with the Citizens' Voice body there in terms of what they're going to do and how they can be part of that engagement process, because that relationship was always going to be important, but with that activity on our books now, it's even more critical. So thank you all very much. Ivan, is there anything you wanted to pick up just in conclusion? I'll give you that opportunity.
No, thank you. I think we've had enough questions. That's great, thanks.
Thank you, Ivan. Okay, if we move then on to item 6.2, and I'll invite Claire, the Director of Finance, to introduce the finance report. Claire, over to you. As ever, we look forward to your slides.
Oh, good. Great. Well, what an intro. So we've had a busy month since we last met as a board. As Helen alluded to, from a financial perspective, that was brought up in the Health and Care Social Committee and Public Admin and Public Accounts Committee that we attended and supported. But that wasn't the only scrutiny that finance was subject to in the month. We had a detailed scrutiny with the Finance Delivery Unit on our forward projections and our current performance in terms of run rate, which I'll share with you in the forthcoming slides. We've also seen the outcomes from the work that's going on the strategic workforce group. So they are translating into some commercial packages that will underpin and hit the run rates in the second half year. And as mentioned, we have the Link and RIS transfer that will undergo financial scrutiny and validation to ensure that we transfer those assets and construction in the appropriate and technical way. And finally, it's also worth noting that obviously it was a nail-biting another budget that we also witnessed with the new Prime Minister coming into force. And obviously the fallout from that and the implications for our budget allocations has been part of much discussion around the Directors of Finance table, which obviously I now sit at. So obviously we are now, our attention is now turning into quite some detail as to the opportunities and threats for next year in terms of the financial and economic position. So I'm going to summarise and take you through some of the DHCW highlights for the month as at the end of October. So if you could kindly move on to the next slide. So what am I going to cover? I'm going to summarise our overall strategic and statutory requirements in terms of financial performance. I'm then going to go into a bit more detail. I'm going to share with you those run rates that were scrutinised during the month, and also then look at what that means for the DHCW Directorate performance, but also look at our savings, COVID, and our, importantly, the Digital Priorities Investment Fund allocation and progress to date. We'll then touch on the capital position, have a quick look at the balance sheet, and then I will share with you some additional information as what we're doing and what we're contributing to for the overall financial position. And then hopefully you'll be happy with that and sign that off. So if we move to the next slide. So the report will cover our core allocation. I know some of you had additional training this month from the Finance Academy, but we look at our performance against our core allocation. The COVID response, as we all have seen, our activity really reflects that upturn in COVID activity and rates. So you'll see the vaccine and the implications of that for us as DHCW. And then the Digital Priority Investment Fund, which we've touched on actually in the performance, to show you how we are, what our financial trajectories are and where we are in that as we have passed the half year. So if we move on to the next slide. Against our statutory requirements, both from a revenue and capital position, and also the way we pay our suppliers and our cash balance, all are in line with expectations and comply. I think it's important to note that we are slightly underspent. We are 437 underspent in terms of our revenue position. Capital similarly slightly behind, but as we see, the second half year is when our activity kicks up. And our cash position has fallen. It was over 6 million last month. We're down to 5.6, but bearing in mind our year-end target is a position of 2 million. If we move on to the next slide. So I talked about our run rates, and it's definitely a game of two halves, a bit like the Welsh game earlier this week. So if you look at the first half, actually our run rates were relatively flat. And I think that really reflects, and you'll see in the second half year, the impact of the Digital Priority Investment Fund coming in. And that funding, if you remember, we had a lot of discussion about funding letters and allocations. As they have now crystallised, you'll see the second half year, that activity really starts to kick up. And the key players in that are, as what you would expect, the top four Digital Priority Investment Funds. So that's the digital services for patient and public. We talked about the private and public beta, that activity is obviously going to have an impact on our financial position. Equally, WCCIS and the medicine management programs, again, towards the second half year, you'll start to see some of the work packages and activities catch up. I think the worry for me is that there's a lot of activity in the last month of the year, and as a finance person trying to reach my 2 million cash target, that will create some challenges. But that's something we're working in detail with, alongside even on the team and the programme managers, to understand that and assure Welsh Government and ourselves that is actually the reality. So if you move on to the next slide. In terms of our organisational performance, so as you know, we're split into directorates. And as you can see, there's, as you've seen in previous boards, actually most of those directorates are busy out recruiting, and that slippage is really reflecting the underspends across the board for most of those directorates. The touch point is obviously in ICT, and again we've worked closely with Cadwyn and the team to minimise that impact and offset the cost pressures for next year. And we're doing a bit of detailed work in understanding what the recurrent pressures will be going forward, and therefore how we can fund and allocate our allocations to balance those out. So that's really the directorate allocations and performance, which leads to a 437 underspend. If I move on then and look at our savings plan, I think it's true to say that unlike other organisations, we are delivering on our savings plans, and in fact, our savings rate is influenced again by that vacancy and that pay efficiencies factors. We have a target of just shy of 2.5 million. We are anticipating we will achieve that, and that actually 1.1 million of that will be recurrent in nature. In other words, they will be sustainable. Again, I think going forward, this will be an area of focus for us next year, and across all health boards and trusts, this is clearly an area of focus and touch point at the moment. But generally speaking, we're doing well, but really reflecting, I think, those pay efficiencies that we talked about in the previous boards. If we move on. COVID then. So again, what we've seen here is a within track and trace, we've seen that spend really settle into what I would call the necessary fixed cost, really reflecting our licensing and support within that. And we are looking at how we minimise that in the next 2 quarters, but equally what the future expectations from Welsh Government are going forward in that space. Within the vaccines, though, as you know, and I'm sure a lot of you have had your boosters. Again, that activity is kicked up in September and October, and you can see there the consequences in activity from letters and texts, which then has an impact into the spend programme that we're doing. I would also say that we are doing quite a bit of modernisation work in this space, so that also comes into play later in the year in terms of the spend profile. That's COVID. If we move us on then, and have a look at our Digital Priority Investment Fund. This is a significant allocation of funding from Welsh Government, 31.6 million. And what this chart really shows you is a split of that 31.6 million for the year by programme, with the dark blue showing you the actual and the light blue showing you the anticipated. Obviously, the top areas actually is where the most influence is. And again, we've done quite some work together with the programme leads to understand the sort of second half year profiles and the assurance around the delivery of that and the procurement underpinning it. So the National Data Resource, the Digital Services for Patient Publics, Medicines and WCCIS are the key areas of focus for us in that space. Having said that, we did reduce our allocation this year by just short of £1 million, and what the table on the right shows you is where that reduction has taken place. So actually, as we meet the half year, and given the funding letter position, I am reasonably happy with that trajectory. And also, we are now starting to see some of those deliverables, particularly in the digital services for patient and public, come into play, and therefore the spend profile is pretty secure. So if we move to the next slide, please. In terms of capital, we have 3 areas of capital allocations. One is our discretionary, so that is our allocation, which was within our gift to allocate. As we already decided, we were focusing primarily on the NDC network, as we talked and Carwyn touched on earlier. Again, that the majority of that is going to hit in the last quarter, which is always nail biting. But we are we're becoming more confident in our ability to deliver that now. And again, there's a few minor spends. In terms of the Digital Priority Investment Fund, we've got an allocation of 5.7 million, and to date we are broadly in line with plan, so no issues to date to report on that one. And finally, there is some minor capital spend in relation to track and trace and the vaccines. So I'll move us on and then talk about our balance sheet. And I love this, but I won't spend much time on it. We've got a balance sheet, so this is our assets, and as you can see, they are quite significant at the end of October, really reflecting the moods, the rules of the game that we play against. So IFRS 16 has kicked in, and we've had to adjust and reclassify some of our contracts into our balance sheet. The other big influence in our balance sheet is the Microsoft contract, which is again the way that we procure and act as the agent for all the NHS in Wales enables us to have a significant prepayment on the balance sheet. And again, that this is now something that we are totally in control of, which is kind of nice. And we are really looking to exploit the position on this every month together with Welsh Government, because obviously this has an impact on our cash. So I'll move us on. So in terms of the financial risks and opportunities, obviously we've touched on it before. We are highlighting digital inflation and supply cost increases. We are seeing the energy costs, and we do monitor the energy costs, particularly around the data centres. But equally, we've done a detailed analysis of our supply costs. And to date, we have mitigated some of those, but it's next year that we're really starting to see some of that kick into play. The opportunities, although I know I'm looking through this as a financial lens, is our vacancy position, which enables us to deliver on our savings, but equally enable us to look at third-party suppliers. We've had, and we continue to have, as a result of the hybrid working, travel expenditure underspends, and we are using our position contractually to exploit VAT, and we're looking to recover that this financial year, and we're working alongside the HMRC to enable that. And equally, we've done, as part of the balance sheet transfer, is we've looked at balances, old balances on our balance sheet, and we're looking to unwind some of those and support the Welsh underlying position. And finally, we've also done the analysis around track and trace, which may enable more releases for later in the year. So I'll move us on to the next slide. So to summarise then, we've had a busy couple of weeks in the finance team. What we have done is done a detailed forecast for the end of the year. We've been scrutinised by the financial delivery unit. We've also been scrutinised on our future strategy. From a financial revenue perspective, we're slightly under plan. And I think really that reflects the recruitment position, and that clearly is across the organisation. Equally, if you look at the COVID spend, we are seeing a bit of a kick up reflecting the vaccine rollout, and there's no surprise there. And equally on the DPIF, the 4 key programmes really dominate the spend profile, and we're really scrutinising those more closely now, particularly in relation to the procurement underpinning that. So that really summarises where we're at the end of October, and I would therefore request to the board that you accept and you approve the report. Thanks. Thank you.
Thank you, Claire, for that, as ever, very clear walk through where we are in terms of our finances. Anyone got any questions? You know, my everlasting observation is around the non-recurrent basis of our that we just need to be very, very mindful of it, because otherwise we do build ourselves misery on misery, don't we, year on year. Alistair.
Thanks, Chair, and thanks, Claire. That was really clear, and there's an awful lot of reassuring material that you covered there. It's just to inject a reference point for our key partners from the perspective of the NHS, key partners in local government. Their financial position, whilst it's different from one council to another, there are 22 in Wales, it generally looks to be about as severe a situation as certainly I can recollect, and Sam, you'll have some very close knowledge of this, but perhaps we'd agree, Sam, that it's about as serious a position as local government has been in for decades. So this year looks to be one of pretty much across the board very serious projected overspends against existing budgets, and next year looks like it's going to be absolutely brutal from the point of view of budget shortfall. And the reason I mention this is that, you know, we obviously need to be as cognizant as we should be as to our key partners across the system, but also just how this might back up in terms of, as I've mentioned in previous meetings, just whatever difficulties that might back up to for the NHS as a whole in terms of the impacts on capacity and resources with such an important partner in terms of, for example, social care. So it seems extremely likely that there will be significant downsizing of councils across Wales, across the UK, but across Wales. And whilst frontline services will always be the most protected, it's very difficult to protect all aspects of frontline, and there is quite often just a lack of good understanding. You can't have a good frontline if you don't have proper backup and support. So, you know, it's really just to give a reference point for this for one of our absolutely central partners, that it would be not a big surprise to me if we actually get to what in local government terms is described in called Section 114 notices, is effectively bankruptcy, where revenue for next year may simply not match the planned expenditure. That would not be a surprise. It, however, is extraordinarily unusual across local government as a whole. But that's how serious it is. So I just wanted to give a reference point for, you know, we obviously don't live in a sort of hermetically sealed bubble or anything. We're dealing with those very dynamic situations with partners, and I just thought it might be useful to feed in that as a reference point. But thank you.
No, thanks, Alistair. It is as grim. And am I right in that the Welsh Government budget of the date I've got in my head is the 13th of December? Is that correct, Claire? The publication of it?
Yeah, so we are, you know, we used to get it, I think last year we had it Christmas Eve, which was always lovely, isn't it? But yes, we're looking to get that mid-December. And look, I appreciate that there are some very difficult choices across the system. I would say, you talked about bubbles, I would say the NHS Wales bubble is under significant pressure, and we are using words like unprecedented. So it will create challenges for us. And I think the challenge to us is that we make the right decisions, because we will have to make some choices, and they are well-informed decisions. And I actually do see that digital, and we had a joint session last Friday with the digital directors of finance, the digital directors and the directors of finance, following a very detailed analysis of next year to really highlight what Helen's been trying to highlight, is actually the assets we've got and how we sweat them, and the investments that we are making that will come to fruition over the next 3 years that we need to exploit. And I think the investment in DHCW will yield those returns. And what we need to do is we have to work together and support each other, because the important thing here is the citizens of Wales at the end of the day.
Absolutely. Rowan, and then we better move on. Thank you, Rowan. Okay, thank you all very much. Thank you, Claire, for that, your presentation, your report. And as Claire mentioned, we've been asked to discuss the finance report, and obviously I think receive and note it as well. It's important that we do that. Thank you very much. If I can move then on to the next item, item 6.3, which is our half-year review of the Border Share Assurance Framework report. And Chris, you are going to introduce this item.
Thank you, Chair. Yeah, I'm going to run through some slides and bring exec lead colleagues in for each of the strategic missions that relate to them. So this dashboard will be familiar to a number of board members who've played quite a big role in its development over the last 12 months or so. I am conscious, however, that there are new board members, so I will run through the first few slides before I hand over to the exec leads with strategic missions assigned to them for them to update. And I would just note as well that there is additional work to support this dashboard. There's a spreadsheet with controls, assurances and actions that backs this up. So that is available for board members should they want more detail. What we've tried to do is for each strategic mission, keep a position statement to one slide, which has been a challenge, but we've managed it so far. So I'll work through the first few slides. So the next slide, we'll just start with our risk appetite position. So Rowan has mentioned this already. So this summarizes our risk appetite statement and our operational tolerances to risk. These were agreed by the board last year, and you'll note there are a number of areas where we are cautious or risk averse, particularly in relation to things like information storing and maintaining and citizen safety. And there are other areas where we have a more open risk appetite. We have now assigned risk appetite to each of the 5 strategic missions, which we'll come on to shortly. I think the one point from the risk appetite statement I just wanted to highlight was that was agreed by the board last year, was that DHCW must take risks to achieve our strategic missions and deliver beneficial outcomes to stakeholders. The next agenda item, item 6.4i, you'll see from the work plan, we are planning as a board to revisit this early in the new calendar year. So there'd be the opportunity to reflect on this, where we've got to and whether it's relevant as it is now. So if we move to the next slide. So this is the principal risk summary. So for each of the 5 strategic missions, there is a principal risk which is articulated on this page. Along with this, the risk scores, as was agreed, as the initial risk score, as well as the target risk score we're working to achieving. And if we look at the next slide, we'll see through the heat map what the planned actions for 22-23 is aiming to do to aid the mitigation of the principal risk through effective controls, assurances and actions in order to continue to drive the delivery of each of the strategic missions. So the heat map just illustrates that generally we're trying to reduce the likelihood of the principal risk occurring and therefore increase our likelihood of achieving the strategic missions we're working towards. So the next slide is the assurance summary slide. So before I hand over to each of the exec leads for their strategic missions to talk through progress, any delays or concerns and their RAG score status, I just wanted to highlight the risk appetite for each of the strategic missions. So for the first 2 strategic missions, we are taking a cautious risk appetite approach. I think this reflects the high number of controls and compliance that we have in place around information governance and cybersecurity frameworks, as well as accepting very little risk that affect the delivery of our operational digital services and applications. In terms of strategic mission 3, we have agreed a moderate risk appetite, so we will take some risk to deliver expansion of the digital health and care record. The strategic mission 4, we are taking an open risk appetite, so we should expect to see far fewer controls in place and accept risk in pursuing value and innovation from data to improve outcomes. And the final strategic mission, we're taking a moderate risk appetite. And again, this is a very broad strategic mission, as Claire's update will no doubt illustrate. So you'd expect us to take a moderate amount of risk in order to pursue our strategic mission of becoming a trusted strategic partner. So I will hand over now to each of the strategic mission leads, and rather than coming back to me, if you could just hand over to each of them. So I'm going to hand over to Ivan, he'll hand over to Carwyn, back to Ivan, then Rydian and Claire, if that's okay.
Thanks very much, Chris. So here we are on the first slide. And I'm just going to report on the reasons why we have placed this as amber in terms of where we're at on assurance, and pull out two specific examples. So the reason why we are at amber is because we haven't made the progress we'd intended to do or had estimated we would make. Firstly, on the open architecture, and secondly, on the work around the data promise. There are different reasons for both, and I don't think that there has been any weakness in anyone, and I want to remind members that this work in essence is about documentation and setting out clearly that we have the regulations that we need, and that we fully report and consistently on those regulations. So we've got a clear plan as to what we need to deliver in terms of open architecture, rules book or standards across the system, but there has been significant pressure on the architecture profession across the organization over the past 6 months, following the retirement of one of our predominant or senior principal architects. And we have two very substantial programs afoot, which are the app and medicine transformation, which has required quite a lot of the architects we have in terms of planning how the new products will link into the rest of our national systems. And there's had to be necessary prioritization of those. You're all familiar with how the minister has been placing digital medicine as a principal priority for us as an organization. Then in terms of the data promise, at the beginning of the year, we framed this as us supporting Welsh Government to lead on this work. During the past 2 months, the Welsh Government has asked rather that we would lead on their behalf then, and we are communicating via letter with them, just to be clear as to what exactly the implications of that are and how we will succeed to take on that piece of work. And so there has been some delay in that regard. So nothing is red, it's amber, because of the reasons I've outlined, and we haven't got to where we'd hoped to get to by this point in the year. There is no change in terms of where we want to get to, and I don't want to highlight any significant risk to service delivery or anything like that. And with that, I'll hand over to Carwyn, and then we'll come back to questions at the end across all 5 missions, I take it. Yep, over to you, Carwyn. Okay, thank you, Ivan. That would be great. So again, we have a RAG score of amber here, and this reflects some degree of progress and clarity in defining the structure and the mode of operation that will be part of our product approach. And far more work is required on this. We've made good progress and are moving forward in our way of thinking, but we need to complete this work now quite imminently. So to support this, we've commissioned third-party resources to drive the work forward, and we anticipate that this support will be in place for about 3 or 4 months until the end of March of next year. We've had meetings with the third party to discuss our requirements and agree on an outline mode of working, and we are waiting for a detailed proposal now, and we expect that to come in the coming week. One key part of the product approach is with user experience. So we're pushing ahead with some of this work anyway. Our head of engagement is starting in a fortnight's time, and she will have a key role to play. Also, our service desk has started to work with our single record team to adapt the system and the feedback process that the service desk already has, and trialing this then for the Wales Clinical Portal, or the WCP. And the aim is to collect feedback more frequently from all WCP users about their experience of using the system. Also, we've re-established more increased visits to hospital sites by the technical teams so that we can get key people from our teams to speak directly to the final users to discuss their experiences of using our product and how they would like those products to be developed. And so this work to define this work has milestones and a framework for working. Until that's created, we won't be changing the RAG status from amber. So I can hand back now then please to Ivan for mission 3. Thank you, Carwyn. I'll be very concise on this one. Again, it's amber. I think perhaps amber green, but we decided ultimately that we would go for amber. As you've heard earlier in the meeting, we have made good progress over recent months around extending the health record, for example, to Velindre around cancer and similar other services. And as Carwyn's just mentioned, we've appointed a head of engagement, and you've heard a little bit about the app and the private beta and how we are drawing feedback from users in on a regular basis. So there's quite a lot of progress made. It's amber because our objective here is that we formalize that as a way of working across the entire organization. So there are lots of good things going on, but they are not part of a firm established pattern across the organization in its entirety. And that is why we've scored this as amber. There is a risk here, and Chris will touch on that in the risk report on the next item, and I'll come back to make a comment on that, risk 299 in the next item. And I'll hand over now to Rydian.
Thank you. As you can see on this slide, the amber rating in the top right-hand corner is amber. The risk appetite, as previously articulated by Chris, is open. We've made some good progress during the last 6 months. We hit the key milestone with the development of the Digital Health and Care Wales Research and Innovation Strategy, and of course that was approved by the board in September, and we continue to have useful board development sessions on taking that forward. There are some areas, of course, that we still need some clarity. Digital Healthcare Wales functions regarding how we process data, and our work with Welsh Government, as highlighted by Ivan regarding the data promise, should put us in a better position to understand the what before we do the how. Finally, David, Selway and I have been having some discussions about what value from data means. Here's some background in this from Rolls-Royce. So we've had initial discussions, and we've got some follow-up planned for the middle of December as part of trying to work out that. I don't have any further comments to make on the slide. So I have to hand over to
me.
Claire.
Yeah.
Okay, so unlike my colleagues, I've ranked this green, and it really reflects the progress we've made on the action plan and the progress on the actions. So we went through it, and what difference have we made? Well, the ISO audits have been complete. We've had positive outcome, and as Helen touched on, the ISO 9000 and 14001 have done. The People and OD strategy has been approved by the board in September. And obviously, as part of that, we've laid out our plan on succession planning and the approach that we're going to take. So again, we are taking action on some of the risks we identified. The Health and Wellbeing Group has been established, and that reports to the Learning and Partnership Group Forum. The Head of Engagement has recently taken a post. Again, that will drive the partnership working, and the Assistant Director of Comms has been appointed and will join early in 2023. The Welsh Language Scheme has been approved by the Commissioner during this period. So again, we've taken steps to address that, and progress has been made working with Welsh Government on our 10-year sustainability plan for digital. So the group decided that actually we had made significant progress in tackling some of the action plan. That said, we did have quite a discussion on what mission 5, what wasn't there that should have been there. For example, we've done quite a lot of work in CO2 that is really should really fall into this strategy and mission. So I think it's given us food for thought in terms of how we will update this going forward, and what we can elaborate on to this particular mission. So we ranked it as green. So I think I hand back now to Chris.
Yeah, thanks to all the exec leads for their updates. And I think, you know, this is for us an opportunity to make sure we are having focused time. We've got 5 strategic missions, and it's, you know, it's a priority for us as an organization to achieve those strategic missions. So this is our mid-year point where we reflect on how far we've come, how much we've done. And also, I think, as Claire alluded to, give ourselves a bit of challenge back. Are there things that are important to mitigate risk that aren't captured? So I think we've had a helpful reflection. Happy to take questions.
Ruth's got her hand up. Just to give Helen a heads up, I might be interested to get a sort of a global view, you know, almost like sort of, you know, we've had the individual diving down into each of those missions, but it would be interesting to hear from you sort of where you think we are across the piece, if you like. Ruth.
Yeah, did you want Helen to do that first?
No, I'll give her a moment. Give her a moment to ponder it.
Thanks, Chris. Thanks everybody for those updates. Very helpful. My question is actually for Alistair. Given your comments earlier, Alistair, around understanding how we link things back to our strategic mission and our key areas of focus, I was just wondering what we would need to do in these types of discussions around the BAF. And when you look at the corporate risk trend analysis, we talk about where our corporate risks are against our individual mission objectives. So am I right in saying that's what you were trying to get at earlier when you were asking about how do things link back to our mission? Does this go some way to doing that? Or are we missing something about how we feed this through the rest of the board conversation?
Yeah, as we were going through it, I was thinking that this is really good and it's all very helpful. I think part of it is probably about us asking ourselves if, you know, who are we trying to communicate some of this to? You know, we're in a public meeting right now, and, you know, if any member of the public were to look at this, would they be able to access this in a way that gave them the picture on the jigsaw box? And we can be clear about the parts that we play and the reasons for each individual decision around agenda items, but actually the level to which they relate critically to key objectives for the year, which is not the same thing as mission, but specific annual objectives. And I absolutely take the point that Ivan was making earlier about the IMTP will help to bring that out. So I'm not trying to be critical of this. I'm just thinking that perhaps we might want to just stand back and take a look at it and see whether or not we are making those connections in a way that we can be sure to ourselves that the decisions we make are relating to our core objectives. And part of that comes back to what I think Claire was just running through in the previous piece, which is you know, it's not only other parts of the public sector that are going to be running into challenging times, it's our part of the public sector too, and that's going to lead to priorities and decisions being made, which is another way of saying what will we not do as well as what we will do. And so, you know, all of that begins to make the clarity about, you know, the nature, if they are core or less core to our key objectives, become, I think, very important in our overall approach to looking at these things. I guess that's what I was trying to get across there.
Yeah, I mean, Chris, I'm sure you can take that away to give it some thought in terms. I thought I was on mute then.
No, you're good.
Sorry, people were looking at me from the other room. It usually means I'm on mute. I do apologize. So you could take that away, I'm sure, Chris, and think about, you know, Alice's key point there around how penetrable is what we're presenting, and then that in the context of, you're absolutely right, Alistair, there's sometimes there's not a recognition that prioritization means that you do some things and don't do other things, because you can only afford to do some things, and we're, you know, almost certainly going to be getting into that space, aren't we, in the not too distant future. Any other comments or questions? If not, anything you wanted to say in conclusion, Chris?
No, just Helen, did you want to come in and comment?
Yeah. So I guess a couple of things really for me. As chief exec and as the exec team, I guess the board assurance framework is a really, really helpful tool in terms of understanding where kind of our key controls and key control gaps are, and the assurance that we've got in terms of delivery of the objective. So as a tool for the organisation and the way we use it, actually, I personally, and I know the exec team, are finding that a really useful way of surfacing and connecting some of the kind of key controls that we need to have in place, and ensuring that we can manage and mitigate the risks to the delivery of our strategic missions. But on saying that, there's always more that we can do, and we know that I think that there are some key priority areas that need some real focus from us, and that is the area that we are spending quite a bit of our attention on. There'll be areas around the open architecture, as even raised, in terms of mission 1, and that whole piece around user experience and how we really engage with and then harness the feedback from all of our user base, and as we know, that will reach across and out into kind of patient and citizen facing as the DSPP program kind of becomes more successful. I think the things to call out, I guess, are the 5th mission, which is focused on us as an organisation and what we're doing in order to achieve and to be high performing and to be that trusted strategic partner. We've done a huge amount in that space, and this is the bit that for me, it gets us into the position of being able to be forward looking across all of the other missions and the stuff that we do, the things that we deliver. So I think that there's I feel really pleased with the level of progress that we've made, and in terms of the way that we surface that, I take the challenge on board, Alistair, I guess, in terms of whether this is kind of something that plays out well to a more public audience, and perhaps that, as you say, that is a fair challenge really, and something that we can take away. But in terms of a tool to support us in terms of managing and improving and delivering in the organisation, it is immensely useful for us as an executive team.
Thank you very much, Helen. Ruth, you wanted to come in?
Yeah, I just wanted to add to that really, because I think Helen captured kind of my thoughts on it. There is a difference between something that we want to use helpfully to communicate to wider stakeholders, including the general public, something that the exec can use to run the organisation, and then also something that we as a board can use to make sure that we're focusing our attention in the right places in order to support the exec in the running of the organisation. So I think there are, you know, there are 3 things here, and it can't be the same thing to all people, can it? And so I think that's what we've just got to be careful of, that actually we're focusing our time in the right place because we've got the right tools, but that we understand how we then communicate what we need to the wider audience. And that might be members of the public, but it also might be members of the clinical community. It might be other stakeholders out there. So I think that's where we need to just be careful that we're talking about the same tools and we're using those tools in the right way.
Yeah. Rowan, then we better move on.
Simon, I think you got to move on, because I think the next bit of the conversation feeds into
the risk
how
register.
this impacts on the corporate risk register, and maybe pick up the conversation when we've done that. It was basically what I was going to say.
Yep. Okay, great. Thank you very much, Chris. Thank you for everyone who's inputted into that report and your presentation on your elements of the report, the framework. If I could then move on to item 6.4, the corporate risk register, and Chris, you again to introduce the item.
Yeah, thanks, Simon. So I'm going to start with 6.4 II and just run through I mentioned at the last board meeting, we were in the process of undertaking some risk analysis on the corporate risk register since our establishment. And we've had the opportunity since then to run that through the two committees and do some deep dives into some of the static risks. So I'm just going to talk this through quickly and summarize where we got to with the two committees. So if we move to the next slide, I'll just start with a bit of context, particularly for new board members. So we approved a risk and board assurance framework strategy at our board meeting at the end of May 2021. One of the key elements of that strategy was to assign corporate risks to each of our committees for additional oversight scrutiny. And another element of that strategy was that each corporate risk escalated would only go onto the corporate risk register with the agreement approval of the executive lead for that corporate risk, to ensure that ownership was clear on corporate risk going onto the register. Internally, we review all risks monthly at our risk management group, which is organisationally wide, and we also review in detail the corporate risks through our management board. Again, that's a monthly meeting. During the period, the 18-month period, so from the start of April to the end of September 22, we've undertaken deep dives on the majority of corporate risks by each of the committees. Not all of them, because a number have come on and come off quite quickly and haven't had the opportunity to deep dive. But certainly those that have been on for any period of time have had that period of deep dive through the committees. We have, as we just identified, started to assign corporate risks or organisational risks to the strategic missions to aid the understanding of the board assurance framework. The one thing I would say on this, that it's not an exact science, so there are risks organisationally that clearly map across more than one strategic mission. We've taken the approach to try and map them to one strategic mission, so there's clarity and there's not organisational risks on a number of strategic missions. And then as part of our plan for the year, we've undertaken this 18-month analysis. So the next slide takes us into the work we've done. So when we established, we had 14 risks on our corporate risk register. Over the period that we've looked at, this 18-month period, there have been 52 individual risks that we've managed through the corporate risk register. Of these, 7 have remained active throughout that entire 18-month period. So we've had 38 new risks come on, and we've had 26 risks where we've been able to mitigate them to either close them or de-escalate them off the corporate risk register. If we move on to the next slide. These are the breakdown of the 7 risks that have stayed on the corporate risk register for that 18-month period. I'm not going to go through them now. I'm going to go through them at the end, just because I've captured some of the discussions that we've had through the committees at that point. So if we go to the next slide, this just illustrates on the table on the right the 38 new risks that have been added to the 14 original risks and the 26 risks that have been removed. And then the graph at the bottom, the assignment of corporate risks, predominantly to the Audit and Assurance and Digital Governance and Safety Committee. And the next slide just highlights where the risks have been coming from in terms of the risk type. So the graph on the right just shows that of the new risks that have come on, the 38 since April 21, there's been an increase, particularly in the last 9 months, of the number of financial risks. So the 12 new financial risks and the 10 security risks. And I think committee members would probably recognise this. We've had a number of financial risks come through Audit and Assurance Committee, and clearly an approach to cyber where DG&S committee members will be aware that that number has increased, and we've taken a particular approach to try and manage and mitigate those risks, which are obviously being overseen by that committee. The next slide, I think, just shows as at the 30th of September, so this has changed slightly, where the allocation of risk is to each of the strategic missions. And I said it's not an exact science, but probably not too surprising that Strategic Mission 2 is where the majority of our risks are live digital services. And then the next slide, I think, just brings us back to those 7 risks that we've worked but haven't been able to mitigate. So I'm just going to run through these as we've done through the committees. We had an Audit and Assurance Committee in October and a Digital Governance and Safety Committee in November, where we've worked through these. So the Canis risk, as has been mentioned earlier, there was a key milestone achieved on the 14th of November. We're in the process of reassessing this risk, and I think Ridian's view, but we haven't done the full assessment, is we need to re-articulate this now as a new risk based on the current risk profile. The risk hasn't gone away, but it is a new risk, reflecting a slightly different context. So that will change to some extent now the phase 1 go live has been implemented successfully. The Welsh language compliance risk, we've taken the approach to break this risk down. It was a very generic risk, and there were a number of areas across the organisation that we wanted to have very focused a look at. So recruitment activity, service desk, and a number of projects we've broken that risk down into. So that one has come off the corporate risk register now. There's a fault domains risk, which we had a good discussion at Digital Governance and Safety Committee. There is a clear target, and Carwyn has set out clear expectations in terms of when he will accept that risk being mitigated to a point that he's happy with, and therefore will then come down off the corporate risk register, and until that time will continue to be monitored through that committee. Similarly, for the next risk, 0229 is a private risk, but just to give some assurance, again, Carwyn has a very clear target metric that we're working towards before we mitigate and reduce that risk score. New requirements and impact on resources on the plan. This is one we'll continue to monitor. We discussed this at Digital Governance and Safety Committee, and reflecting the numerous priorities that have that we've had to absorb, I guess, over the last 18 months. Similarly, the next one, which is a private risk, will continue to be monitored. That's been on since the start, since April the 1st. And finally, the staff vacancies risk, which is assigned to the Audit and Assurance Committee. As part of the process of the last committee meeting, Marion's asked that we do a follow-up deep dive into that one at the next committee meeting, particularly given the work of the strategic resourcing group since the last deep dive into that has taken place. So that's a quick run through of the trend analysis. I'll pause there, Simon. I was going to just run through the report, but I'm happy to pause here if it's...
Yeah, let's just take a moment. There's a couple of questions come up. Helen wants to come in and Rowan wants to come in, and then you can take us through the report then, okay. Chris.
Thank you, Chris. I just want to say how helpful I thought this report was, actually, in terms of understanding the approach we're taking as an organisation to our risk register and to the management and of our risk register, and the way that we're assessing and using risk as a kind of a core, kind of central piece of our decision making in the organisation. I think that the report really helpfully demonstrates the way that the attention we're paying to it, but also the active mitigations and actions that are being taken forward to actually minimise or remove risks where we can, and to read across, if you read across at those ones that have been on there the longest time, that haven't been moved off the register, and to the rest of the agenda today and what we are talking about, actually you can see there are key themes there in terms of the priority areas for us as an organisation. So I thought it was a really good demonstration of kind of the approach that we're taking as a board to risk and as an organisation. So I just wanted to thank Chris for that.
No, absolutely, Helen, absolutely. Rowan.
Yeah, and I think what I would reflect on is this document was incredibly useful at DG&S because it gave us a framework to have a discussion around that was really open and helpful. And I think I sort of took away a couple of sort of conclusions from it. The first is, I think the organisation has become more sophisticated in recognising risk and managing it. And I'll just generalise this. There was one large risk in the private theme, think of it as a big blob of risk. And there was a recognition that by splitting it down into, themes that broke it down with different actions that needed to be taken, we would get a better view of where we were with our big blob of private risk, and that's been very helpful. It was also useful because for me, who sits on the committee, there are some dynamic risks that probably pop onto it and almost move off before they've come through the review cycle. So there is more activity in terms of the organization's risk management than is perhaps apparent if you sit on on the board. So that was a very useful conclusion. I also thought it was just very, very useful to reflect on the sticky risks, the ones that are persistent. They're not ones that we necessarily are comfortable living with, but we are doing all we can to manage them at the lowest possible level, recognizing that isn't necessarily a level that's consistent with our board assurance framework. And I think, Ruth, it kind of comes back to the conversation that we had when we approved the board assurance framework, originally, that we will have to break some eggs to make our omelette, and maybe we can become a little bit more open in certain areas, either by exception or as we gain comfort across the board. And then that also means that we have to think about what are the operational consequences of it, and where that managing of that risk lies within the organization. But I did think it was very, very helpful and useful, and something we probably will continue to do. Not every meeting, but at least annually going forward.
Thank you, Rowan. Marion, you wanted to come in. Diolch, Marianne. Chris, back to you if you'd like to move then on to the sort of the update report and where we are with current risks. And
yeah, absolutely. So item 6.4, so that was the backward look. This is the current position. So just going through the report, section 3.6, there are 26 risks on the risk register, 16 of which are detailed in the papers. The others are marked as private risks. But I will just run through the changes, because although there's 26 risks now, and there were 26 risks at the end of September when we looked at this, 4 have come on and 4 have come off. So just to make board members aware of what those changes were, a risk has been escalated through with Ridian's approval, DHCW 0296 around allergies and adverse reactions. This is around ensuring there's a single source and a standardized structured approach that Ridian has escalated onto the corporate risk register. The second risk, I'll run through them and then take any questions if that's okay at the end. Yep. 0297 power outages. Again, this is a risk that has been escalated through with Claire's approval around potential risk around power outages. Pleased to say, so this came through the Local Resilience Forum and DHCW's own internal mechanisms, but pleased to say there's been some work, I think this week, to test outages and contingency plans in place, and there are workarounds. So this one will be de-escalated relatively soon. 0298, the delays in the implementation of Link. I think it's worth just reflecting on what Michelle mentioned. This service hasn't transferred formally to us. It does on the 1st of January. However, clearly there's a risk that has been identified, and board members will note it's now our joint highest risk on the risk register, so a significant one for us to manage. We did have a long discussion at this at our last management board meeting, and as Michelle alluded to earlier, we will be having a paper in January which sets out, when the service has formally transferred to us, the current status, as well as all the risks and mitigation plans for each of those risks. So there'll be a bit of a focus on that in January, and we will work through how we bring that through to board. The final new risk is DHCW 0299, supplier capacity to support electronic prescription service for readiness activities. I am just going to bring Ivan in on this one, because this was one that Ivan mentioned through the BAF, and it's a new one that he's approved to go onto the risk register.
Thanks very much, Chris. We rely on other suppliers in several areas across a number of our programs. This is specifically to do with the prescription transformation program. One element of that portfolio is the transfer of prescriptions electrically in initial care, and to do that we use a resource called EPS, Electronic Prescription Service, which is delivered by NHS Digital in England. And in order to get all of that to work, there is a need for work by NHS Digital in England, and work is required by the two main suppliers that we have of software in initial care, which is Surgitim and EMIS. We need to raise this with them, that they should prioritise this work in their own programmes, and they, as us, are facing considerable stretch across their workforce. They have corporate priorities of their own, and NHS Digital is currently being absorbed into NHS England at the moment. So there's an awful lot going on for them. And of course, we have to negotiate and come to an agreement with them, and we cannot rely that they're going to prioritise things that we require. So we identify that as a risk. There's not an awful lot we can do to manage that risk, apart from working very closely with them to seek to reduce the likelihood that this will happen, and that is what's reflected in the register.
Thank you, Ivan. Yeah, I think that's an important one just to note, because it is a new risk that's been escalated on. Just to run through those 4 risks that have been removed. So unfunded, the national insurance increase, that has been on for a little while. Change in policy has meant that one's now come off the corporate risk register. 0294, our service ownership and resource commitment for the NHS Wales app. That's been reduced to directorate level. Fair to say there's still a lot of focus on this one in terms of risk as we move through private beta and learn lessons. So I know a lot of work's going on with that risk, although it has moved off the corporate risk register at this stage. The Welsh language compliance risk, as I mentioned through the trending analysis, we've taken a similar approach actually to what Rowan described for the private risk, and taken this off and put a bit more targeted risk around a number of Welsh language areas. And then finally, in terms of reduction in risk scores, the network delays in equipment for the data center 2 move. Again, this one's reduced assurance has been provided from Carwyn, so we're confident on that, and that's come off the corporate risk register. Just to flag the heat map report, as I mentioned, the link risk has now come on as our joint highest corporate risk, and CANISC remains on there, just noting that we are in the process of doing that risk assessment. And then finally, just ask board members to note item 6.4i, the work plan, because we will be revisiting our risk appetite in the near future. So we'll have the opportunity, I think, to build on some of the discussions and conversations from today. Thanks, Chair.
Thank you, Chris. Helen, you want to come in?
Thank you, Simon, and thanks, Chris. I think a really helpful run through. I've got a couple of comments. One is just a minor point, but I think that on risk DHCW 0296, the allergies and adverse reactions. I think the description probably needs slight amendment in that it's, if you look at the resulting in, it says resulting in patient harm due to missing or outdated information. I think probably that should say potential patient harm, because we couldn't be sure of that. I think it'd be helpful if it was updated to that. I just wanted to also mention on the link risk. So that's a risk for us at the moment. We have actually agreed a risk to go on all health board and Public Health Wales actually risk registers to in terms of the link programme at the moment. So we'll probably look at whether there will be an additional risk that will come on to our register, as Chris mentioned, to be consistent with other colleagues for January. And I guess just one to point out when we look at the cancer risk and the CANISC risk, I guess normally where our risk scores are reducing, it's often reducing because the likelihood reduces. I guess with CANISC, what we'll be doing is looking to see whether the impact of any impact or the risk of CANISC actually now will be as severe. So just a reflection for me on that one. Actually, it's a bit more unusual in that sense, isn't it? But, yeah, thank you, Chris. Really helpful update.
Thanks, Helen. Okay, Chris, it says to discuss, but we receive it, obviously, that risk report. I think it's important that we minute it that way. And no, don't think there's any other contribution. Thank you very much, Chris, for taking us through that. If we then move on to some reports from committees that have happened since the last public board meeting, and the first is the Audit and Assurance Committee highlight report. And Marion, is there anything you particularly want to pull out from the written report that we have in front of us? You're on mute, Marion. Don't worry, it had to happen at some point.
Thank you. Yes, well, just the principal points really discussed in the meeting. Can I just draw your attention to the work that was undertaken on decarbonisation? This is the central issue in our last meeting on the 18th of October. We received a qualitative report on decarbonisation that had been submitted to Welsh Government, who are very pleased to receive the assurance of the significant progress that we've seen as an organisation in terms of implementing our plan on decarbonisation. We had a deep dive session on the financial risks, as Claire's mentioned, and that was a really beneficial session. And can I just finally refer to the update we had from Audit Wales? We heard that the work on the structured assessment that takes place on an annual basis, and this is the first such assessment for us as a board, that will more or less have been completed by now. And so it's going to be an important milestone for us as a board. And we will be looking forward to receiving the final copy early in the new year and to consider that formally in the next audit committee meeting. Thank you.
On that, Chris, I know we've got some time carved out at a board development session to have a first look at it. When would we, as in public board, what meeting would we be considering receiving that report at?
Yeah, it wouldn't be till January. But we are planning to do that informally first.
Yeah. Okay. Thank you. Thank you, Marion. And any comment or questions? No, we received that the report of the audit committee. If we move on then to the Digital Governance and Safety Committee, any highlights that you'd particularly like to draw to our attention, Rowan, for the last meeting, which I think took place on the 3rd of November?
Thank you, Simon. So I think people will have read the report that's in the packs. It was a pleasure to have Marilyn join the committee. So great to have you on board, Marilyn. We had a really good discussion, and if anyone listening is interested, you can also download the public session. And I would recommend, in particular, the Keeping Patient Data Safe discussion, which was led by Darren Lloyd. That was particularly excellent. The sort of two risks that I will just remind the board that they will have read about in their papers really relate to the Welsh Emergency Department System, the WEDS programme. That's been rolled out as a minor injuries unit. you know, that there is further work required before that can be deployed elsewhere, and there is good work going on to get that program back on board. And then there was a very strong discussion in the private session about the consequences around obsolete and legacy systems and infrastructure. And I know that there's some work going on amongst the exec team that will come back and give us an update on that. But I think that's enough for now.
Thank you.
The rest is in the report.
Thank you, Rowan. Any comments or questions? Okay, we received that report as well. Thank you very much, Rowan. If we move on then to the Local Partnership Forum, which I believe was chaired by you on the last occasion, Andrew. So is there anything you particularly like to draw our attention to in the report that we've received?
It was indeed me. So there's no items to escalate to the board. It's just really to say that I just wanted to assure members that despite the fact our work's spread so widely throughout the organisation, it continues to be a very successful forum. And just to say as well that the Local Partnership Forum is just a very small snapshot of all the work that's happening daily within the organisation that we often don't get a chance to discuss. Really, we're continuously working. I mean the items are that are in the report. A lot of them are on today's agenda. I just wanted to really highlight the good work that continues to be done, and indeed all the other groups in DHCW that feed back to us from workforce related items, really. And a big thank you to the corporate team, because they're the ones who make it happen so seamlessly.
Thank you, and
questions.
Thank you, Andrew. I think the work that this committee does and the wider relationships between the organisation and the staff are going to be particularly important over the coming months, because as we know, staff throughout the NHS and ourselves, including ourselves, have a particularly difficult period of time in making decisions as around the pay offer, and hopefully the relationships we have through this committee and wider will help us through, say, what's going to be a pretty difficult and testing period in the NHS right across Wales. So thank you for your continued chairing of that co-chairing with Helen of that committee. And I move then, so receive that report. I'm sure we're happy to do that. And I move on to which is me, the Remuneration and Terms of Service Committee highlight report. We only considered one item, which was to ratify the terms and conditions terms of service of the interim and substantive executive director of operations, who I assuming will be with us when we next meet in public. I think that's the case, isn't it? So that'll be nice. We will then, so all stay safe, because we will then for the first time have an absolutely full and complete board. I haven't had any urgent business communicated to me. The date of the next meeting is, the public meeting is Thursday the 26th of January, and I am reluctant to do this, but I suppose I ought to, given that it is the last one, to wish you all a happy Christmas. Welcome, see you back in the new year for the next public meeting. We obviously have other engagements between now and then that the board will be undertaking. So thank you all very much for getting us through, helping me get us all through the meeting this afternoon and today on time. Take care, everyone. Bye.
Thank you.